any other devices because they will interfere. And there was a fair bit of interference last week at the committee. Number of items quickly under Chairperson's business. There's been correspondence from Adoption UK NI regarding the delay in the launch of the public consultation on adoption legislation and seeking agreement to write to the Department for an explanation on the delay and to request a revised timetable for progressing the legislation. Are members agreed?
Agreed, yeah.
Okay, I want to also refer to the announcement by the Minister on the future of Dalriada Hospital. Obviously disappointing, particularly for people who suffer from MS and their families, and seeking agreement that this committee should write to the Department to get sight of the terms of reference that are going to take place for the consultation, and for the Department to outline the position in relation to staff at the current facility. If members are in agreement to do that.
Yes, Chair, just a comment. I know those members that were here yesterday felt very, very let down, and they felt that it was consultation for consultation's sake. So I think, given the fact of the wide interest in the Dalriada, and again commend People Power, they have fought a really, really good campaign, and I think we owe it to them to make sure that the consultation is not to be. They're very concerned to saying consultation for consultation's sake. So I think the phrase was well used during the debate, closing the door after the horses bolted.
And I would, Chair, for a moment reiterate the point that was made yesterday that by not allowing further admissions, it skews the whole debate and undermines the consultation that is supposed to be about at least potentially keeping it open.
Okay, thank you, members, for that. I also, under Chair's business, want to raise the issue of the Professor Kathleen Marshall report on child sexual exploitation, and again seek agreement from the committee to write to the Department to request information on the next steps, particularly in terms of the recommendations that were made in the report. In essence, what work will the Department be doing between now and January, when the Department is due to give its response to the recommendations? I think it would be appropriate that we sought that update from the Department.
Great.
Thank you. Item 5, members, is the draft minutes of the meeting of Wednesday, the 19th of November 2014. Referring members to the minutes, which are page 114 of the meeting folder. Are members content with the minutes?
Great.
Great, yeah.
Item 6, members, is the draft budget. Referring members to page 123 of the meeting folder. The relevant papers are there. I want to inform members that there's a copy of the response from the Department of Finance to the committee's request for information on the establishment of oversight mechanism to monitor health spend and the OECD review. That has been placed on each member's table. Also, just want to advise members that departmental officials are here today, and you're very welcome, to brief the committee on the Department's assessment of the 2015-2016 draft budget. Richard Pengelly, Permanent Secretary, and Julie Thompson, Deputy Secretary, both very welcome. Can I ask, is it Richard yourself to make the opening comments, and then we'll open it up to questions?
Thanks, Chair. I'll just be very brief, if you don't mind, in terms of comments. I think we've provided the committee with a briefing paper. As you're aware, all departments are consulting on the outcome in parallel with the DFP more strategic consultation. Both those elements of the consultation process closed on the 29th of December. In terms of the paper we've provided, just the headlines are that our first analysis shows that we can achieve a balanced financial position for the start of the year, predicated on two core concepts. The first is that we deliver efficiency savings of some 160 million, and secondly that we start the year with no plans for service development. Dealing with the former, the £160 million is ambitious. We need to work through the detail of that across all arm's length bodies. The one point I want to emphasise is that £160 million is absolutely not a cap. That is the target we will be aiming for. Every penny we can push the efficiency challenge beyond that, we will endeavour to do so. In terms of service development, we reckon there's about £110 million worth of service development we could do next year. But the position we're adopting, and this is a consequence of the wider environment changing for us. I think in the past, it's been a very reasonable approach, given the buoyancy of the in-year process, to start the year rolling out some service development and then using the opportunity of in-year monitoring to secure additional funds. The current financial year and all the signals coming from colleagues in DFP are very clear that we cannot expect or anticipate any in-year funding in the future. So we're starting the year then with the basis that we'll identify service developments that we can do as and when funding becomes available, and that funding will either be in the unlikely event there is some additional allocations to us, or we over-deliver on the minimum 160 million efficiency position. In terms of capital, the draft budget position for us has a capital allocation of just over £200 million, 203. We estimate our need for next year is about 253. Of that need, 70% of it are amounts that are contractually committed in terms of finishing projects we've started. So that just means it'll be a very difficult capital position in terms of starting new projects next year. Finishing up then, Chair, just in terms of process, we've initiated a process with the various arm's length bodies throughout the health and social care sector to develop detailed savings proposals and refine the funding requirements and how the draft budget scenario would be deployed at the front line. The aim of that is to have a clear plan agreed with each body before the start of the 15-16 year. It's a challenging time frame, and we will obviously, as ever, look to the committee's support and pushing through with that. That's all I wanted to say, Chair, so happy to take any questions or provide any clarification.
Richard, just a wee comment there. You talked about the capital contractual spend. Did you say that was 70% in 15-16?
Yes, yes, Chair.
What is the contractual spend for the draft budget overall?
In terms of the current as well as?
Well, in the draft budget now going forward, is there a sense of a percentage of money that's...
I think the sense we have that we set out in the paper is based on the position for previous years.
Yeah.
Sorry, Julie,
in terms of, certainly on the capital side, it's fairly straightforward. It's 70% of the budget that is proposed for us. On the remainder of the budget, effectively, we have analysed out for the committee, it's in paragraph, table below paragraph 9, where the expenditure falls based on 12-13, and we wouldn't expect the position to be that much different as we move forward. So when you look at things like we've got salaries and wages, we have demand-led expenditure, which included within that category would be the likes of all the independent sector funding, the drugs funding, and also utilities expenditure. We have then all the FHS work and clinical negligence, and we've boiled it down to an amount of 340 million or so. That is, you know, where there are an elements of choice around it, but I say that word advisedly, in that also has expenditure, for example, the maintenance of the estate and revenue would be in there. We would have computer costs, travel costs, postage costs, telephone costs, that's all within that category. Now, within that, we're obviously looking to explore as much as we possibly can on the efficiency agenda, as Richard has already said, and we'll be pushing all organisations to see what can be achieved. And equally, to be realistic, within salaries and wages, there will be some elements of that which are incurred through the likes of agency and locum, and those people and those staff are obviously providing frontline service care. But in terms of legal commitments, you can release agency and locum staff. So that's the analysis that we've got. We would be concentrating blatantly around the more discretionary spend, looking to see what we can get out of procuring goods and services more effectively. Looking at administration, all of those will be looked at as we analyse where we go forward and get the detailed plans in that support the
So do we
the
have a
overall
percentage
paper.
of the discretionary spend going forward?
Well, in terms of the analysis, we've got 8% out of that analysis is on the other expenditure line of 341. That's that's where we are in terms of what we've analysed. As I say, you have big expenditure, for example, in the likes of drugs, which is demand-led. That doesn't mean to say that we won't be looking for efficiencies there. We will be looking for efficiencies. So in all of these categories, whether it be salaries and wages or anything else, we'll be looking to see what can we do to minimise expenditure and how do you effectively rein that back. And that's what's behind.
So effectively within that
million.
8%?
Within that 8% is looking at that around the discretion, but I would suggest the committee we're not just settling on that, only looking at focusing on 8% of the budget, we're looking right across the budget.
Okay, well just in terms of the strategic priorities and going forward, and you'd be aware that the evidence session we had on the 22nd of October, and the Minister had indicated that there was 3 strategic priorities. The first was the provision of high-quality frontline care. The second was transforming your care, and the third was opportunities for income generation. Can you maybe confirm just today that they remain the top 3 priorities?
I can confirm, Chair, that nothing has changed since the Minister gave evidence before you think they're at the end of October. I mean, obviously, a key issue for us in parallel with the outworking of the draft budget scenario is looking at those priorities. To be honest, I don't think there will be any, certainly I don't think there will be any significant change. I'm not sure there will be any marginal change. The core position of the Minister remains the provision of high quality services using the opportunities afforded by TYC to further shift care towards the left. We are pursuing income generating opportunities, and that's nearly more a tactic than a strategy, because that obviously helps. In my opening remarks I talked about the absence of any funding for service development. With a balanced position as we have at the start of the year, every pound we can generate in additional charging will be a pound that can be recycled into service development. But we are not at the stage of actually putting any firm income generating proposals on the table.
We can't say anything. So if they remain the priorities, then are you at this stage, allocate and spend in terms of those 3 priorities?
Well, the first priority, the providing high quality healthcare, is at the heart of how the trusts will deploy the resources. The board through their commissioning role and the trust through their provider role will do that. So it's not so much that we allocate funding to the priority, as the priority provides the very important context and backdrop for the deployment of all resources. We don't say we'll put 95% of our budget towards providing high quality services and 5% towards TYC. There's so much in providing high quality service. That's the policy agenda and it's the delivery agenda, so we can't carve it up on that basis.
Well, it's actually high quality frontline care, which is different from just high quality healthcare, I would suggest.
Well, I think healthcare occurs at the front line, so I don't see a differentiation between the two. I mean, the point is, within that, of course, we will seek to minimise administration costs, but some form of administration is necessary to have a front line. The front line can't exist in isolation. But
again, I would have thought, Richard, you have priorities. You allocate spend according to those priorities.
In terms of the build-up of the figure work, we have looked about what the existing costs are, and effectively where we've ended up in the current draft budget outcome is that we can afford to effectively pay for the existing services only if we meet the 160 million odd of savings. But we're not at the stage at this point where we can then say, in terms of optional areas or priority areas to put new investment in, that there is money available to do that. So I think the question you're raising would more apply when we get to a point that there's potentially a service development pool that you can put new money into. We're not at that stage. We literally only have the money available to sustain the existing cost base moving forward. And there just simply isn't any resource at this point to finance new service developments during the currency of 15-16. Now that may change as things work forward, but that's where we currently are at the moment.
It doesn't necessarily follow to me that you don't have, you don't allocate according to your priorities, and I would think that would be a requirement in any budgetary process going forward in any department.
But Chair, the money is being allocated. The priority is to provide high-quality frontline services. The money will be allocated with the view to providing frontline services. There's a whole continuum of activity below that in terms of the issuing of a prescription to an individual and the dispensing of that drug as a frontline service, minor procedures, ED. I mean, all those issues are frontline services. The prioritisation of high-quality services goes to the measures we take across that whole continuum of services. But we could say that we could identify how much money we'll spend in TYC, and the balance will go to prioritising frontline services. I'm not sure that actually helps.
Well, I mean,
us in
okay,
terms of
if what you're saying today is that what you're going to do is look at existing services, then you're going to look at existing services, but has there been any thought given to do those existing services, given the constraints that you talk about and refer to, are they actually even in line with the strategic priorities that the Minister announced?
But that, when we talked about the £160 million in savings opportunities, that is a combination of doing the right things more efficiently and stopping doing the wrong things if we define the wrong things as not playing towards that strategic prioritisation. So that's a piece of work that we'll be looking at in some detail.
Yeah, but I'll try this again. I mean, if you're talking about existing services, and I appreciate constraints, and you're saying if you had a pot of money you could do X, Y and Z, but you're saying now that you'll continue to fund existing services. That's where the priority is. But has there been any thought given to those existing services actually being in line with these three that were given to us on the 22nd of October?
Maybe our language is confusing when we say we will continue to fund existing services. That's shorthand and maybe inaccurate on our part. What I was saying is, at this stage, we are not putting any money to the introduction of new services. We're starting by maintaining what we have, but part of maintaining what we have is questioning to make sure it continues to be fit for purpose, it continues to be of a maximum efficiency. To the extent that that releases any money, that will be recycled into the pot of new service development that at the moment has nothing in it but that we want to do. So we're absolutely not saying that whatever we did last year we will continue to do in the future in the same way we did it. What we're saying is at this stage we have no funding to go beyond that. So we start by examining what we did last year and making it better.
Okay, so would you accept that that approach may not necessarily be strategic, certainly wouldn't be innovative?
No, I wouldn't. Sure. You
wouldn't? These, in your words, aren't strategic, so they potentially are counterproductive to the direction that health is going?
No, I don't accept that.
You don't accept it? So that they are strategic to continue?
We're starting strategically. The strategic point is to say we cannot do new things that we don't have the money to do. I think that's a fairly sensible and strategic point. Beyond that, strategically, we're saying let's look at the totality of the health service. Does it meet the needs that it's seeking to meet? Does it meet those needs in the maximum efficient way? We're asking those questions on a strategic basis, top down. We're asking the trust to look at the detail of how they provide services. We will be looking at opportunities to realign service provision to make different specialties work together. That's, I would say, is a very strategic approach to this. And that's done in the context. I mean, we have to deal with the reality of what we have, which is a finite budget, which doesn't go far enough. But within that, we're operating on a strategic basis.
Accept that, but we also want to be able to deal and stand over with the fact that the strategic priorities that were identified to us are collating themselves with allocation of budgets. And I'm not hearing that, but you see, in terms of the issue about priority, and again I'll go back to the evidence session on the 22nd of October, and the Minister had been asked at that stage when is a priority not a priority, effectively, and the simple answer was when you don't have the money. That was the response that he gave us, when you don't have the money to pay for it. And there was then a follow-on question around public health. And, again, given the fact that that has been a key mechanism in terms of the whole direction of our health service, the Minister talked about the importance of the Public Health Agency and about encouraging people to take particular lifestyle choices at that stage, is what he said. He then went on to say However, again, we are back to the funding issue. We do not have the resources to give it the full status that it deserves. So there seems to be that recognition by the Minister that he doesn't seem to have the recognition that public health, the importance of it in terms of delivering, transforming your care, but that he also has the right and the responsibility to prioritise one aspect of health and social care over another.
I think, Chair, there's a risk of confusing prioritisation with discretion. I mean, clearly the Minister is on record as saying that the public health agenda is a priority, but the reality is that's discretionary spend. Within a finite budget, if the Minister has a statutory obligation to provide certain services which consume the vast majority of that budget, the amount left over is the amount that he can deploy to discretionary areas of spend, notwithstanding any prioritisation of it. So, when a GP prescribes a drug, we have a statutory duty to pay for the cost of dispensing that drug and the cost of the ingredient. Now, we do work to try and reduce that, but there's a whole host of areas where we have statutory obligations to fulfil that have a bill. That comes out of our budget.
Yeah, but again, and I accept that, Richard, up to a point, but again, the Minister has referred to public health as a priority, and yet when we see the key spending areas from your paper today, it talks about an allocation of 21 million beside public health.
But that's...
It wouldn't suggest to me that it was a key priority.
If I can help the committee on that one, the 21 million that is there is the element of public health agency spend which is going out to non-HSC bodies. What you will find is within the area of hospital services and even probably in social care services as well, there is public health expenditure being incurred within those headings as well. That is the way our expenditure is analysed for database purposes for DFP. And as I say, the 21 million pounds there is the bit that is going out with our bodies, if you like. The actual public health agency spend is of the order of 80 or 90 million pounds. It's something of that level.
Okay, and finally for me, because there's a number of members that want in on this, again back to the session on the 22nd of October, the discussion around, again, decisions over what areas of health and social care should be prioritised. And Richard, you yourself had indicated obviously the challenge that the Minister had in terms of trying to bring all those individual strands together, and you talked about the very difficult funding envelope, as it's called, and making difficult choices, and that if we want to invest more money into primary care, that needs to be sourced somewhere else within a fixed overall envelope. Those are the choices and issues that we will be looking at as we go forward with planning for 15-16. So specifically, what I'm asking is that, is there current thinking within the department in terms of how that allocation would be split across both primary and secondary care? And are there any, potential changes to the split or the allocation?
I mean, I think the point I made, Chair, is too many, there is an imbalance in terms of the funding between primary and secondary care. At the moment, a lot of the funding in the secondary care environment is largely fixed and committed. One of the issues that we're looking at in the development of this position, as we take the high-level position today and trust work through the detail of that, they will be looking at ways to maximise throughput, to reduce average length of stay, to better manage bed utilisation. Those issues are ongoing, and that is primarily focused at releasing as much funding as we can from the current system of operating. There's a pause at that stage, obviously, for the Minister to consider how best to redeploy that in the context of his strategic priorities, but a big issue there will be the extent that that's redeployed towards primary care, which is entirely in keeping with the TYC agenda, and that's the direction of travel. So I think that would be very high up on his list of things to do. But I think the key point is I can give you an absolute assurance that we are, throughout this process, looking at any and all ways of, whilst accepting there are some services that must remain in place, about squeezing every penny out of those services, looking at alternative and better ways of providing them, just looking at more efficient and effective working, better throughput management. to release funding to be deployed to other areas, which will also have, I think it's the very point you make, will have a longer term impact on reducing demand in that secondary care environment. So the answer is that's
So
sort of long way
potentially the
cycles.
allocation could shift.
Yes, I mean that would be our desire to keep pushing in that
Okay, but
direction.
what I'm hearing in answer to that, and that's a useful conversation, and it's useful to know that thinking is going on. But you did indicate that would be subject to alignment with the Minister's strategic priorities, which in the first question you were saying, no, it's just about existing services.
Sorry, Chair, that's not what I said. I'm sorry if I wasn't clear enough, but that absolutely. All money will be spent in accordance with the Minister's priorities. But we don't allocate money to priorities. We allocate money to services in the context of the strategic priorities. So decisions about deployment are taken in the context of priorities, but priorities don't deliver services. They're the framework and the context within which services are delivered.
I think maybe
There's
the
still
other aspect.
strategic priorities.
Yeah, the other aspect of this is further on in the process, we would then be working with the Minister around the commissioning plan direction, which advises how we would expect the service to respond within the money. It isn't all just about the money and the allocations, it's about what is expected to be delivered with those allocations. So we're not at that stage yet, but that will come through further on, and that is where absolutely the Minister will be specifying what he wants to happen and in terms of service performance, but we're just not at that point at this stage.
I think, just to supplement that point, the commissioning plan direction is evidence of the issue that you're seeking comfort on. One of the issues that I have raised in terms of moving forward in that, it's very much skewed towards a series of metrics about the performance of the secondary care environment. I think we need more recognition in that direction about the importance of primary care and the impact it can have, and the process of commissioning itself to test that it is working properly and driving the improvements in performance that we all aspire to.
Okay, I have on this similar theme, I have Fergal.
Thanks very much. Could I interrogate this just a little bit further? Because from what I'm hearing between last week and this week, or last 2 weeks ago and this week, is I think it's legitimate to ask, are there strategic priorities at all? You've just described the income generation as a tactic. We'll see transforming your care funded as and when, and the rest is what a health service does.
Well, sorry, the reason I use the word tactic for income generation, I think we could all agree that income generation in its own right, we're the executive to levy a range of charges on the public, and that was the end of it. That in itself achieves nothing other than arguably penalises the public. The key element is what is done, and what is done with any revenue raised through income generation is how it's deployed in accordance with the priority of providing high quality health care. So that's why I see this subtle differentiation between income generation and providing high quality health care. I think income generation is a means to it, but it is not an end in itself. That's just why I'm trying to draw that distinction out.
Yeah, no, I appreciate that, but on the transform your care side, I mean, as a strategic priority, it was about, to interpret anything I'm saying, but it was what it was written, was about putting care into community and therefore achieving some of the outcomes in strategic priority 1, and also achieving efficiencies. So therefore, when Julie says at the last meeting, we're not even at a scenario where the basics can be funded at this point, never mind therefore identifying what is top priority out of those service developments, it is actually undermining strategic priority 2 not to be giving it a priority. And it's undermining the outcome in terms of frontline service in the community.
I'm not sure, forgive me if anything we've said has actually caused confusion at this point. TYC remains a priority, but I think the point Julie made at the last session, and I'm trying to make today in obviously a clumsy way, is that priorities, discretionary priorities, can only proceed where the funding is available. That determines absolutely the pace at which they can go
just
forward.
to be clear, and I'm sorry if I'm interrupting you, but this was the first question that the Minister was asked. What were his strategic priorities?
Yeah.
And one assumes that if that's a strategic priority on the top page of the paper, that things flow from that. And yet we're hearing you saying, and I mean, I'm not accepting or not accepting what you're saying, I'm just listening to what you say about one being a tactic. Clearly, you're not funding TYC, that'll be as and when. And how can that be? How can those two be strategic priorities at all?
Well, TYC is being funded. The issue is about the pace of funding.
Yes.
But the simple reality is, where we have statutory obligations and the pace of TYC is a discretionary choice, the Minister has no choice in legislation but to fulfil his statutory obligations first. And if that consumes all available funding,
Yes.
but I struggle just to say, if he has no money left for a discretionary priority.
Yes, but it's our job to work out. It's our job to work out also where the strategic priorities are. Ask the Minister and ask you whether your decisions are being informed. Our key decisions are being informed by the strategic priorities. And I'm going to ask this as a question: are they being informed by the strategic priorities, or is it just a matter of let's fund what we
They're
can?
absolutely being informed by the strategic priorities. The strategic priorities is to provide high-quality health and social care services. That's what we're doing. We're putting money to fulfilling statutory obligations, and in parallel with that, we're undertaking programmes of work to make sure that the fulfilment of those statutory obligations is done in the most cost-effective way. For all discretionary spend, we're testing, does it adequately contribute to the provision of high-quality health and social care in the way we want it to? And as against that, we're taking... So the real choices are in that discretionary piece between TYC and other discretionary spend. So on the one hand, it's maintaining the statutory services, releasing as much funding as possible to be realigned towards the strategic priority of TYC.
So the strategic priorities are only in relation and decisions to what new services are available, for example, not in relation to ongoing frontline work.
But where the frontline work is a statutory obligation, we have no choice but to do that. We have discretion as to how we fulfil that statutory obligation, and that is a key point about, on the one hand, fulfilling that obligation, but doing so in a resource-effective way. Where resources are released from that, they can be recycled with that strategic prioritisation. So you've been trying to come in to correct me.
And maybe an example of that is in terms of how we've been working with the smaller arm's length bodies out with the trusts, where they have been asked to plan around a range of planning scenarios of budget reductions of 5%, 10% and 15%, seeking to understand, if you like, what can be reduced and removed from those bodies and then reapplied across back into, as you describe, into the priorities and into the frontline service care. Now we're working through that. We haven't got the answers to all of that yet, but that would be expected to, if you like, be an example of what Richard's talking about, where we look at can we take an existing cost base of what we've got, look to see what we can change in that, and then shift that resource into the frontline service care.
Yeah. Just to be clear, is that exercise being done against the strategic priority or against a 5, 10 and 15% mathematical exercise?
Each organisation at the moment has been given a 5 and 10 and 15% calculation of what it means. Blatantly there then considering that against what they as an organisation are set up to deliver. We will then reflect on that. What we're doing at the moment is doing that organisation by organisation by organisation. That will then be pulled back through into a corporate consideration across the whole health and social care piece, because you may get to a better position by doing a slightly higher amount in one body, a slightly lower amount in another, or taking a different approach across several of the bodies. So that's like the second phase of looking at that material, all designed to ensure that whatever decision comes out of that, which will be taken by the Minister, is around meeting his priorities, ensuring that we're taking resources and moving those into frontline care. So it's starting off, yes, against a mathematical target, but will be very much driven by what the bodies in themselves are there to do, and then what the health service is there to do in its entirety. And that's one example of how you do that shift from an existing cost base into doing things in a different way.
But if they're doing it, and sorry, I'll just finish the point here, and I want to come back in some other stuff, but if they're doing it on that basis, won't there be a danger that some service provision is just going to fall through the calculation, if you like, and that we're going to miss out on essential service by virtue of the fact that you're doing a mathematical financial exercise?
I think, and sorry, Julie can provide the detail. The key point about the 5, 10 and 15% scenarios is to give us a sense that for each organisation at a 5% end of the spectrum, what would they be able to deliver and what are the important things that they would like to deliver that they'll be unable to do. At the two ends of the spectrum of 5% and 15%, is when we look at all those issues put together across all organisations, we will then make judgments. And, for one organisation, we could say the things that you would like to do but will be unable to do in a 15% reduction are more palatable than this organisation, what they would be unable to do with a 5% scenario. So it'll be piecing all those pieces of evidence, but it'll not be mathematical that you and you will be 5%, you will be 10%. It'll be based on the implications of those scenarios as presented by each organisation.
Okay, Chair, thank you.
Thank you, Fergal. Joanne?
Thank you, Chair. In the Finance Minister's statement to the Assembly on the 3rd of November on the draft budget, he said, and I quote, "If past performance is any indicator, it is likely that many ministers will seek to make the savings required by their department by way of an identical percentage cut across their services. This is my view and the wrong approach in these circumstances. Those savings in this process may involve the cessation of some lower priority services in departments." So, can I ask then, what lower priority services is the department planning to reduce or stop in 2015-2016?
Well, I think that's the very reason that we've asked all organisations to do the 5, 10 and 15% scenarios, so that we can see what would the implications of various scenarios for each organisation be, and then it's only that analysis that allows you to compare the relative merits of a service in organisation A with a service in organisation B, which within our environment are both competing for the same limited pot of funding. So it's when we see that analysis as we go through the development of the final budget process.
But you're bound to have an idea currently with that analysis.
No, because I absolutely want to make any decisions in this based on the evidence that's produced about what the actual implications. So I don't want, I'm deliberately trying to avoid. I mean, my starting point is that as a minimum, everything must become more efficient and we must ruthlessly question all service provision to make sure it remains valid in the current context.
So currently you have no idea what they will be. You can't.
I'm wanting to run an evidence-based budget process, so I'm awaiting the evidence and I will review it and then we will provide advice to the Minister.
It's simply a timing issue in terms of where we are in the process, and all of that procedure that you're talking about in terms of working up the detail, understanding what that means and then being able to clarify, well, that implication is something that Minister is prepared to accept in the circumstances and this one is not. That's the process we're absolutely working through at the moment, and until you actually see it in the round and see where every organisation sits in that, you could potentially making a judgment about one organisation which then is undermined by where another organisation sits. That's part of normal processing at this point in the year.
You appreciate that, and certainly does cause the fear and angst out there. Can I ask then?
I think, sorry to interrupt, it would surely cause more fear and angst if before we saw the evidence about what things really meant that we took decisions about what we were going to stop. I think
It was more than certainty. I think it's a fear as well, and the evidence definitely needs to be taken, but it's just that uncertainty around it. Can I ask, it may sound like a pretty obvious question, but when you're looking at budgets, who do you put first, the patients or the Department of the Health Service?
patients.
Patients always. It's just, in this week in particular, it wasn't a patient's first approach with Dalriada. It appeared more finances first. How can you give us and the public the confidence that future budgets will not continue to reflect that approach, that it will be patients first?
I'm not sure how I can give you something that would provide the comfort that you want from me, other than to say the Minister is absolutely committed to putting the patient first in terms of the services we provide. The Minister was absolutely clear with the Northern Trust and the Dalriada issue that the alternative forms of service provision must be of a high standard. And indeed, I was speaking to the Chief Executive of the Northern Trust earlier this week. He has visited some of the sites of alternative service provision with the MS Society and with some of the service users, and he tells me they were very, very impressed with the alternative service provision that is being made available to them. So that is very much about putting the patient at the centre of what we do.
don't think the campaigners for the Dalriada would agree with you there, Richard, but I don't want to get into an argument about the consultation and the Dalriada and where we are with it now.
Sorry, could I just say, sorry, I think your question is very much about putting the patient first. The campaigners for Dalriada, there have been 69 people have used the service. That is the
those
people
that were allowed to use the
well,
service.
they're the people that sought to, the facility was there, more people wanted to use it.
It wasn't,
so they're the
it
very
wasn't
people that
widely
have been,
across Northern Ireland. We know the service wasn't a widely. Contracts weren't there with, for example, my own area, the Southern Trust.
but other trusts have their own. I mean, the service is there if they choose to use it. They choose to put in place their own forms of provision. It's sorry, I'm not to get into an argument at this point. I'm just making the distinction that when we talk about putting the patients first, we absolutely talk about the patients and the users of our service, and they're the people that the Chief Executive of the Trust took to see the new facility. I understand that other people will be unhappy with the differential model of service provision, but it's very much focusing on the views of the patient and those who actually do use the service.
I don't want to get into an argument
of
now,
course.
Chair, and I think the 4,200 MS sufferers across Northern Ireland definitely don't want to get into
And
this.
we have agreed to write to the department just expressing that concern.
Could I ask
Appreciate
a final wee point,
Sure,
if I may? At point 28 on page 36, you estimate £143 million is needed to meet contractual commitments, and these include Bambridge Health Centre and new paediatric units, Craigavon and Newry, amongst others, that list there. You say commitments will have to be met. Is there a note of disappointment in this phrase? Because are you saying if you could delay these projects, you would? Because I'm very, very mindful that that would be certainly a bitter blow to everyone who has lobbied hard for these facilities.
No, it's absolutely, this is not said with a heavy heart at all. This is simply reflecting that these commitments will have to be met. So we have no capacity to exercise any discretion to not do this, to allow us to start something new. We must finish the things we've started before we start new things. So apologies if it reads all
No,
on
I'm
that.
glad if you're reassured
No,
of that,
it's
because I'm
absolutely
just thinking
just-
of the campaigners
No,
as well.
absolutely.
Finally then, Chair, the 143 million obviously is an estimate.
Mm-hmm.
Do you expect these projects to be led in any way if it is an underestimate, if it goes?
I think the fact that, I mean, Julia will have, those projects have started, so I think we're confident that that is a good estimate of the amount that will be needed in the 15-16 year to take those
but
projects
things
forward.
can obviously always change just depending on how the contractors get on or on the but this is based on the profiles of those individual contracts, and therefore that number is a relatively hard number at this point. Subject, as I say, to things moving as you go through. Just
So it will not be affected if it is an underestimate?
No, those ones effectively already in contract, already on profile, being built, and therefore what you're doing there is profiling the spend for 15-16 against the contract that you've currently got. The only thing that then would swing that is if something happened within that particular contract to cause an unforeseen delay. But other than that, that 143 million will be spent on those contracts in the
But if you need more money to finish the contracts, if that 143
a lot of
million is
those,
an
a lot of those
underestimate-
schemes will go on into absolutely 16-17, and indeed some of them potentially beyond. So, what we have reflected within this paper is the spend anticipated within the
But it will
15-16 year.
not affect the outcome. They still will continue if it's an underestimate.
I think if there is a small underestimate in terms of any of them, if you take one of those schemes and we have a figure next year of 10 million, it turns out to be 11. All experience says that managing a portfolio of schemes, some or other of those schemes will have experienced delay. There'll be adverse the builder won't have done as much work, so that will be manageable. So I don't think that the figure 143 will not under any circumstances change, but any change at individual project level will be managed, and estimating figures will not be a barrier to these projects proceeding as planned.
So regardless if it's over budget,
Yeah.
someone that will
We
continue.
will continue.
Thanks,
Okay,
Chair.
thank you, Joanne. And we're going to move into the transforming your care issue. Fergal, indicate
Yes,
if this.
thanks. And it'll probably relate back to some of the earlier stuff that we're talking about. But on a specific, how much has been spent to date on implementing TYC out of the substantial millions that was originally estimated?
Right, Julie, I tried to figure 29 something in my head.
think it
It
is.
was 19 in the first year, I think another 6 then the following year, and I think this year we're heading to 13. Something of that order is where I think it is.
That's what you told me last time you were on.
There
It's only
you are.
13. At least we're moving forward.
Yeah. So 19 plus 6 plus the 13 is where we're at.
It's like 38.
38.
Sorry.
That's
So-
by the end of the year. By the end of
The
this
end of
year.
the financial
End
year.
of quarter 15.
Yeah. And I can just hark back to the previous meeting that we had, and the fact that you said that significant elements of funding need to be addressed first before we get to any additional funding. And it is back to this prioritising. Why should existing services be prioritised over the implementation of TYC? Why are you approaching it that way?
I'm struggling to find a different way to say this. Where those services are enshrined in legislation and there's a statutory obligation to provide them, no minister can take a decision not to do that, to do something that is discretionary in nature instead. So that's the short answer to the question.
Yes, but you could be, another way of doing it, for example, would be in an ideal world if you had, invest, save money, real money, that you could go and provide. So, but that's on the one hand, and what you're doing is on this hand. Why aren't you exploring further ways of doing that put meaningful community with the potential for savings but greater and more efficient delivery in the community? Why aren't you doing more of that?
We don't have any investor-state funding, and the executive hasn't established one.
No, I understand that, but TYC will always, I predict that it will always, but the way that you're approaching it, it'll always be the poor cousin out here fighting for some kind of funding without ever getting to a tipping point where it's meaningfully going to deliver. So why aren't you exploring, or just ask the question, what's the logic of the approach that you're taking? And is there another way that you could think about doing it differently that would deliver in the community?
I would be more than receptive to any suggestions you have as to a different way to do it. It's not that I'm not prepared to look at alternative mechanisms. The reality within a finite budget, and when a huge proportion of that budget is consumed by the provision of statutory obligations, the balance of spend that is discretionary is spent in accordance with priorities. We have allocated not as much as was in the original 2011 report, but bear in mind, when you produce a report that sets out an ideal scenario, you're not constrained by a difficult financial environment. So the 70 million of transitional funding that was identified in the report, over a 3 to 5 year period of implementation, we're only 3 years, just the tail end of 3 years in. But the reality is we need to fulfil statutory obligations. Now, I'm receptive to anyone giving us ways of dealing with that.
Can I just add, in terms of statutory applications, maybe just outline a number of examples of those?
Well, the vast majority of our services are enshrined.
Demand. I think that the essence of our services are so demand-led in that if anybody tips up at a GP or at a hospital, an A&E, and requires assistance and help, then obviously there is an obligation to assist and treat those people. When you get into the likes of elective care, there is discretion around that, and you'll see that on the list alongside TYC and alongside a range of other issues whereby we can put an element of resource to that, but not necessarily everything that would be wished for within that expenditure area. So you're looking at understanding where effectively services are currently being implemented and where patients require assistance and support, and that applies right through the social services side as well. Obviously there's an awful lot of risk assessments going on that side to ensure that vulnerable people are also being assisted through social care services. When that is done and worked through, how you then change what you're doing and how you then move resources more into and provide more opportunities around those strategic priorities is about looking about, well, what can we stop doing, what can we do more cost effectively, and that's behind the essence of the 160 million. We've got 160 million within that analysis, and if we can increase that amount, that would enable us to move into the space of then putting further resource into those discretionary areas. So what we're doing at the moment is effectively saying the services that we've currently got have a certain cost. we have to then look at how we can manage and reduce those costs, and potentially, yes, maybe that means stopping doing certain things. That's driving the 160 million. As Richard has already said, if we can increase that 160 million, which will be a challenge, but if we can do that, that would enable you to put more resource into either an Invest to Save, all the opportunities there around service
And
development.
that's useful, but are you
process.
currently reviewing, the contractual obligations that are there in terms of existing services? Is that piece of work ongoing?
Whenever the trusts are developing their savings proposal, at the moment we've got a top-down, effectively, approach to this. When the trusts are developing the detailed plans to support this, what we would absolutely expect them to do is to analyse and understand, well, what can you do, where's the discretion, what can be done better, and what are the proposals around potentially changing and doing things differently.
But is the department doing that?
The expenditure and the detail around understanding individual contracts would be within an individual organisation's. You've got an organisation of £500 million or £1 billion. Those teams, those trusts need to understand their cost bases. They understand their contracts. They understand what they can stop, and when contracts maybe come to an end. I've already said about, for example, the flexibility around salaries and wages, which tends to be in the areas of agency and locums, but you can't just necessarily take that expenditure away without having an impact on the very frontline service that potentially you're talking about. So understanding where all of that is very much driven from the trusts, then presenting that information back through. We can give them advice about avoiding implications on frontline services, targeting administration, targeting procurement, targeting rationalisation of estate, back office functions. All would be expected to be maximised within the proposals that they will work up, and that process will go on between now and into the new year to get to a viable, detailed savings plan where we can be confident, both within those individual organisations and as the department, that those proposals have been interrogated and asked the questions that you're asking. But we can't do that from the department. That has to be done from the individual organisations themselves.
Okay, sorry, Fergal, go ahead.
Yeah, that's okay. But the
Can I give one
discretion.
illustration? Of the fact that I hope this illustrates we are doing the thing that you're rightfully asking us to do. In the current year, when the in-year funding we got, a lot of the services, and however we describe them, when people are ill, we do seek to fix them and make them well. There is an issue about timing and hence waiting times for some elective procedures. That's where the element of discretion comes in, that ultimately we will provide the service and we provide an environment when it happens, but the consequence of not having all the funding. You'll recall that in the session on the allocation of the additional in-year funding, we could have put all that funding to additional elective capacity to try to reduce waiting times. But there was a judgment call about the importance of continuing with TYC. So some money went to reducing the elective issue and some went to TYC. So those issues are examined, and where there is discretion, the Minister exercises it.
Yeah, but there does appear to be less discretion then, if we're accepting a little bit of discretion, there seems to be less of it available for investing. And after all, TYC it's about delivering cost-efficient services in the front line in the community, so that's the direction. But there's more discretion about cutting services. And this recent round, I know we don't want to get into it, but this recent round is actually cutting some of those community services and undermining the strategic priority.
Well, I think you're probably tired of me making my points at the last session. The current contingency measures are short-term measures to get us to the end of the year in a very difficult financial position. But TYC is still proceeding. So it's not as if we could have completely stopped TYC, any work in TYC or incurring any expenditure this year in TYC, and reduced the need for, it would have marginally reduced the need to implement the contingency measures. But the judgment was taken that some of those contingency measures, and I understand people in different parts of the committee will have different views, but some of those were seen as being more palatable than a complete cessation of progress in TYC, and that's the view the Minister took. So it is proceeding in difficult circumstances.
Yes, but I mean, if TYC is proceeding in that way, and they call it fledgling, or what we're in danger of doing, surely, is cutting away at those young shoots, if you like, and community availability. and undermining the very project itself. So who is thinking about that, and should the cuts and further consideration not be slightly further up the tree?
The best way I can answer that question is say, were we to accelerate TYC this year, which in an ideal world we're all in exactly the same place, we'd want to do that. The only way we could accelerate TYC this year would have been to spend more money on it. To spend more money on that would have been either spend less money on dealing with elective procedures and allowing waiting times to extend even further, or to introduce additional contingency measures and contemplate closing more units. That's ultimately a judgment call, and the
Yes,
position we arrived
but
at.
nothing that what you've told me today makes me think that you're going to change that next year, that thinking.
Well, what I've said today is we're starting the year with a balanced financial position. So, and the main reason for that is that we absolutely avoid the scenario that halfway through or 2/3 of the way through the year we need to be implementing contingency measures that have the sort of noise we're hearing in the system now. And within that context, we're allocating funding to continue to take TYC at the pace which is short of what is absolutely desirable, but what is affordable, in accordance with a parallel assessment with other priorities. That's all we can do.
But it does leave it in danger of being a rhetorical priority as opposed to a strategic priority.
It's absolutely a strategic priority. Money is being spent on it, but the reality is we cannot and will not spend money we don't have. So accelerating beyond the current pace would require more money. If we don't have the money, we need to make choices. And that's what will happen as we get the evidence through from the Trust and other arm's length bodies.
Okay, thank you, Chair.
Okay, thank you, Fergal. Rosie?
Kimberly, and thanks for the presentation. Just on the same issue there, if I could just ask you, whenever the Minister was at the committee on the 22nd of October, he was asked whether he'd considered profiling more money for TYC into the baseline for 2015-16, and he said that, well, yes, in an ideal world he would like to do that, but if he was to do that, it would mean taking money then out of budgets for like health care, cancer and elective care and pharmacy and other kinds of things like that. So given that was the statement, could we just get clarity on what that means? So does it mean that the Minister is prioritising a range of existing services above the implementation of TYC?
It's difficult to give a definitive answer on this, but some services, in terms of creating the capacity to deal with issues, as I've said about many services, the only valve available to us is the waiting time. So for some areas, orthopaedics, arguably a longer waiting time is more palatable to both the Minister and the public. But in some areas like cancer, we have set very short targets, and the Minister puts in place a requirement for 100% compliance with that target. So in those cases, I think the Minister is putting existing services above TYC, and I want to be careful of not speaking for the Minister, but my sense is that his view is that for areas like cancer treatment, it is arguably more important that anyone who goes to their GP and gets a red flag about potential cancer, that is more important, that issue is dealt with, diagnosed and treated, than we take forward a TYC programme. I think for other areas, the Minister would say maybe we can afford a bit of a stretch in the waiting time to access that treatment, because taking forward TYC is a greater strategic priority. So it's all those sorts of judgments against a whole range of services that need to be made and answered. So it's not a simple yes or no in terms of the totality of it.
Yeah, but I mean, coming from what you're saying then, what it sounds like is that transforming your car will never be implemented, because there will always be other priorities then which will be more demanding, and so it will be the poor cousin. It sounds like that to me.
No, I genuinely hope it doesn't, because the TYC report, when it was produced, always talked about 3 to 5 years. That was in a fundamentally different financial environment. So, the reality is, I suspect we'll slip beyond the 3 to 5 year. We're already at the 3 years, but there will be an end point to it. We will get there. It remains a priority, and we continue to pursue any. We will be submitting bids in all future monitoring rounds, and to the extent that we're not taking forward TYC at the pace we want to, we will be bidding for resources.
There still will
to
be
forward.
spend going through in TYC supporting all the initiatives that have been put in place to date. So it's not that there will be no expenditure on TYC in 15-16. What the analysis is saying is we support all that is currently there, and then we need to look at how we fund any new service developments within this particular area. And in order to do that, we're identifying £160 million worth of savings that we need to achieve first and foremost to deal with the current pattern of services, and then look to see what more can be done in order to increase that. And that would provide an element of resource potentially for the likes of TYC looking ahead. But you can only strategically, in terms of saving money and moving it, we have to be able to first ensure we can deliver the 160, and then, if possible, increase that 160 to provide more funds available. We will be looking at any and every area to try and achieve those savings, and that does, I think, get to the essence of where the committee is at about potentially some things or you would stop delivering a particular thing which would allow you to provide resources available for new service developments. If we can reach that point, that would be, I think, where everybody would like to get to. But there's £160 million worth of proposals that have to be developed in order to get to that place, and that's not easy to do in the context of where you've got increasing demands and increasing expectations coming on an ongoing basis in terms of looking for both acute and community services.
Which initiatives would be initiatives that have still to be commenced or implemented in terms of introducing transforming your care, or has everything started?
No, I mean, I think there would be a programme of work that they would like to take forward, particularly with it through the integrated care partnerships, and trying to build on the pathways that they've already looked at, looking ahead. And they would absolutely want to do more work around that, about ensuring that people are on constant and consistent pathways on the frail elderly, for example, and that work is spread right across Northern Ireland. They would also want to do potentially work around outpatient reform, and how do you deal with how people currently go to outpatients and whether there's a more effective way of dealing with that. So there's a range of initiatives driven particularly by the integrated care partnerships, which they would want to be able to put in place, which are aimed at managing demand and ensuring that people still get the appropriate care that they need. So that, but the issue is, in terms of priorities, is that we need to be able to fund the ones that are currently in play, the initiatives that are already there, and then consider how the new initiatives would sit alongside. But the only way you can finance those is by effectively stopping or doing something that we currently do differently. And we are absolutely open to that, and the Minister is too. The issue is about identifying what those proposals are, understanding what the implications of those are, and weighing up whether the new investment, for example in TYC or in elective care or whatever the service is more preferable to stopping doing something else somewhere else in the system. That's the process that is very much ongoing at this stage.
And how do you monitor the partnerships to ensure that they're working as efficiently and as effectively as they can be?
There's a reporting mechanism through the Transformation Programme Board, which is chaired by the Chief Executive of the Health and Social Care Board. And through that, there's a mechanism whereby each ICP would provide information about what it has been delivering. There's benefits that have been assigned as well, as I understand it, to a considerable number of the initiatives, and those would be tracked and monitored as well. It's early days in some of those initiatives, and obviously I know the committee has been interested in the past about the extent of shift left within that, and looking for more to be done, so we appreciate that, but we are absolutely have mechanisms in place to monitor, but you have to do that sensibly and proportionately, otherwise what you do is create a considerable level of bureaucracy around it.
Okay, thank you.
Thank you, Lizzie. And George?
Thank you, Chair. My question again is around TYC, and I would like to ask, one of the objectives of TYC is set out in the programme for government is that by 2014-15 they have shifted 83 million. Now, you may have answered some of this as well, or before, from hospital-based services to community primary-based services. and in 2012-13 the amount shifted was 11.4 million, and in 2013-14 the figure was 13.6 million. Could the officials outline what is the projected shift for 2014-15 and 15-16? You may have answered some of that already.
I suspect we haven't answered it. The reason being, I think we'll need to come back to you with that, because obviously the issue about 14-15, we're focused very much on the 15-16 issue today, and so I don't have that information with me. How much will be shifted in 15-16 depends on the final outworking of the final budget, so we don't know how much will be shifted in 15-16 yet. How much should be shifted in 14-15, I think we can come back to you in writing with, if that's okay, Chair.
Is that okay,
I think
Chair?
you've put up for
Yeah, I
government
mean,
session next week.
But again, what I would suggest is that if we don't know,
That's right.
how do we influence, if you're saying that you haven't quite decided in terms of the shift for 15-16 for TYC, how does this committee scrutinise or influence or impact
But
on
Chair,
that?
the point of today is to look at the evolution of the final budget for 15-16. The amount that will be shifted in 15-16 depends on how much investment we make in TYC in 15-16. Those decisions haven't been taken. This is the first stage in that process. We've launched a public consultation today. We're asking trusts and all organisations to work through the detail of this. When we reach that final position, we will know how much shift left that planned investment will facilitate. But we don't know that until we get through the process of planning for it. So it's not that this is something we know about that we're not telling you, and we're not asking you to hold us to account on and comment on, but that
Yeah,
work
George, go ahead,
work
yeah.
through needs to
And then Ciara
happen.
wanted to add.
Chair, how soon can you provide that information for us?
In 14-15 we can come back fairly quickly.
Yeah.
In 15-16 I suspect it'll be in the new
It'll
year.
be further through the process. We need to have clarification on the final budget, and then do a further round of liaison with all the bodies. So as Richard said, we aim to have a clear plan on everything before we go into the new financial year. So it'll be into the springtime before we'll be able to answer that question with the clarity that you would expect.
But I have to come back on that because, we're out to consultation. We're out to consultation and we're asking, never mind the role of this committee, but we're asking the wider public to, respond to a draft budget consultation, and we haven't even put a figure on the key benchmark of the delivery of health.
Chair, the totality of the health budget is approaching £5 billion. We received the draft budget scenario, I can't remember the exact date, but sometime in October. It's simply not possible to work through the detailed allocation of every pound in that period of weeks. The consultation is about setting out the broad direction of travel, asking a series of questions of the public to let that come back and let that influence the Minister's final decisions and allocations. This is not peculiar to the health service. This is a similar situation that my colleagues across all departments will be doing. This is the process we operate.
Yeah, but the broad direction of travel is transforming your care, and I think we've all accepted that. But we're being asked now to consult on how a budget supports a strategic departmental priority without knowing what that allocation is, if it's good, bad or indifferent.
But part of the consultation process in this early stage is more about getting the sense of the relative weight of that, and for the committee to say what, the scale of ambition that you would hold out for the investment in TYC next year. As I say, Chair, this isn't unique to the health service. This is the way public sector budgeting is undertaken. The executive sets a very high level position. Each department takes a high level position with their own environment. That goes out to public consultation. That analysis and evidence comes back, and ministers and the executive make final decisions. We expect those decisions will be early in the new year.
Which is about, I guess, informing the final budget across all departments. That's the level, effectively, of what that consultation is about. And it is early in that planning process. We need to understand what that looks like and then work it back through with the bodies concerned in all of its detail. That is a complex piece of work, and we need to have the confidence that that has been worked up with all the savings proposals identified, that we can all say, well, okay, yes, that is what's been delivered, that there's clarity in terms of service performance around that, and that's the detailed planning that will go on right from now through to the start of the new financial year.
But I think the point, and I think Kieran indicated on this same issue, is that ultimately and certainly from the information that we've been looking at in terms of financial scrutiny, it is too late then. People respond to this consultation now by, I think it's the 29th of December. They're being consulted on, say, for example, a priority, which is TYC, which they don't have an allocation to. When you decide you have an allocation, what does the wider world do in saying that's right or wrong? They can't influence it then. We can't influence it then.
But I think, I think this goes to the basic constitutional point. The part of the consultation are to get the views of the public, and the views of the public and others are very much about the relative priority of this, the scale of investment. Ultimately, it's for the Minister to decide, and the Minister is awaiting the relative inputs from all those key stakeholders and the analysis that we've talked about earlier from the various arm's length bodies within the organisation. But the pace that this is working, that's the way the process works.
Except there's an issue about pace, absolutely, but I think I've made my point on that. Kieran, did you want to comment on this?
I'm looking at a map here which tells me the 2014-2015, and that was your question, wasn't it, to our guest, and it says transforming your care transitional costs for that year is 8 million. Is that the figure that we're looking at for 2014-15?
The question was about the shift left in 14-15, not the level of investment in 14-15.
Is the difference?
Yeah.
That 8 million is for what then?
The 8 million is, if I think I understand the paper you're looking at, is out of the £80 million made available from the monitoring rounds. The total spend in TYC, however, in 14-15 we expect to be in the order of 13 million, so an element of it will be paid for within existing resources.
13.6.
That's ultimately separate from the 15-16 going forward. George, had you finished on that?
Yeah.
Okay.
Yep. Thank you.
Thank you. And we're moving on to under frontline services. Kieran?
Chair, again, we have already spoken about this. The Department has received the additional 200 million for 2015-16. The DFP wants to ensure that this is spent on frontline services, and we all fully support this ideal. How does the Department define a frontline service? There's more here, but...
well, I don't have a ready definition of your frontline service. Is basically, I think, inevitably involves patients or some contact of patient or client contact. But the term is shorthand to differentiate really from administrative structures which support the provision of health and social care, as opposed to the absolute provision of health and social care. It becomes a bit grainy. If we talk about public health initiatives, the good promotional work about lifestyle choices, healthy eating, that to me arguably is a frontline service, because it's trying to get a message to patients and clients, although arguably it's not sitting in the same room with a stethoscope around your neck dealing with the client. So I think there's a range of frontline service, but it's really about the differentiation between administrative support and back office work. Okay.
Will you internally ring-fence the 200 million, or do you plan to absorb it into the programmes of care at this stage?
What we plan to do is we will look at the total. So we will not specifically ring-fence the 200, but what we will do going forward, and through particularly the 5, 10 and 50% scenarios, we will ruthlessly squeeze down on all form of non-frontline, the administrative support, the back office work. So we would expect that in overall terms the health budget will increase in cash terms between 14-15 and 15-16. It will be our intention that we either reduce administration costs, or certainly administration costs increase at a rate lower than that headline increase, which means that more than the 200 additional we to the front line.
And I think to add to that, in terms of the draft budget, it had a savings, a target of 49.5 assigned to our budget against that 200 million. But our figure we're working to a much higher number than that. We're working to over 160 million. So the commitment within health at 49.5 would not be sufficient in order to address the pressures that we've got. And therefore we're looking at a much higher number than what the draft budget originally indicated.
Right. Do you have any further info from DFP on how they are going to oversee all of this?
No.
Right. But can we move on, Chair, then to efficiency savings and income
Can I just-
generation?
Sorry, yeah, Fergal wanted in on this front
I just
line.
wanted to
Go
come in
ahead, yeah.
specifically on this point. Thank you for letting me in. Well, if the PHA could be represented as a frontline service, and the definition, albeit vague, involves some form of patient-client contact, surely the fire service is a frontline service.
The fire service is a frontline service. The issue is about, sorry, I thought the question was about sort of frontline health and social care service. Fire service is a frontline service. There could be no question about that.
In that sense, then, is it funding ring-fenced?
No, we're looking at the funding scenario again for the fire service around the 5 and 10 and 15%. They've been asked to articulate what that means for them. We've working to receive that information from the fire service has started down that journey, and we need, as we've already described, to understand what the implications are of that and how that plays alongside all the other priorities that are there.
I think the key point here is that in the broader context, there are many more frontline services take place in Northern Ireland than happen in my department. The executive position has been in terms of allocations to protect health and social care, not to protect frontline services generically. The draft budget position for health is very good in comparison to our colleagues in other departments, most, if not all of whom provide fundamentally important frontline services. They are having to ask their organisations to look at a series of reductions. The expectation on us is that the executive has set its stall to protect health and social care. So we need to ask the question of the fire service.
Yes, but part of the other consideration is that in terms of the Minister's definition here is that we provide efficient and safe services. And if there are certain cutbacks, you could raise the spectre of safety being compromised in terms particularly of the fire service. And so therefore, should it not be exempt from that range of potential cuts that you're imposing, given that role?
I don't think there's anything between us in terms of the end point. The Minister will not, it's absolutely clear, he will not preside over unsafe service provision. At this stage, we have asked the fire service to tell us what 5, 10 and 15% would mean. Based on their input from that, the Minister will take decisions. The Minister will not allow unsafe services. But I emphasise, that question is no different than has been posed to the police service, to TransLink, to all those other range of public and fundamentally important public services. The issue that we are asking it, as opposed to giving it that automatic protection, because the executive has been clear that the protection for us is for health and social care. It is not for any other service.
Though you would agree, wouldn't you? You may not, but that the fire service does involve itself in terms of its capacity and needs to keep that capacity, and involves itself very much, for example, linking with the ambulance service, freeing patients from cars, etc. So there is a health consideration there in terms of that role.
I agree, but I suspect PSNI would say exactly the same. And they're not getting the protection that we are. I think ultimately where we end up will come down to the safe provision of service. And I say the Minister is absolutely clear that safety is paramount. I think the Minister's position vis-à-vis his executive colleagues, if the executive has decided to provide funding to protect health and social care, I think at a first pass the Minister would be uncomfortable in using some of that funding for health care in contravention of the executive's wishes to support fire services. So I think he needs to look at that. But asking the question about what the scenario means, the final position will be dependent on the information they provide and the analysis of that. But to say that, I think the key point, the Minister will not preside over unsafe services. He absolutely recognises the importance of the fire service and the important service they provide to the whole community.
Okay, thanks for that. I know I dropped down into specific, but
Yeah, thanks. Your paper states that you intend to make £113 million efficiency savings during the 15-16 period in the Trust, and you detail a range of possible measures. What direction will the Department be giving the Trusts in terms of where and how these savings should be made?
We will be, in terms of the sort of the heads we've given there in paragraph 17, we've given them a steer that these are the sorts of areas at first pass that we feel savings could be made. So we will want to make sure that the dialogue happens with the board as Commissioner and with all trusts to make sure that where we identify best practice and opportunities in one area, that they're cascaded across all trusts. This effectively is the starter for 10 with the trust, that we feel there is particular potential in these areas. We are absolutely not saying to trusts, if you do this list, you don't need to look any further.
Right.
And we'll be ensuring that there is a good, cohesive dialogue, that each individual trust looks at their own area, but every opportunity they identify is flagged up to their colleagues in other trusts so that we can
And that they
maximise good practice.
clearly articulate what, if any, service implication there may be from those proposals, and confirming that they're viable and can be achieved within the 15-16 year, and that they have a plan effectively that drives that proposal out. So there's a range of things, and obviously the focus on back office functions, as I've already said, around the likes of procurement. That's, you know, what can we buy things cheaper and better, looking at estate services and how those are done. So there would be a focus and an expectation that they look at those areas, but they will have to look much broader. You will not get £160 million out through just back office functions. That just wouldn't be possible. So we expect them to look right across their services, and there is absolutely then learning between one trust and another in terms of where they're at and what their proposals are. That's the work that's going to happen between now and the early part of next year.
And will there be sufficient communication between everyone involved, right down to the public, the general public? Because the last thing we want is to hear at the end of a busy week that someone's going to be slashed from this hospital or that hospital or wherever. So communication is important.
Absolutely,
Right,
but we need to
throughout.
get the plans worked up.
Okay. Again, at the evidence session on the 22nd of October, the Minister stated that exploring opportunities for income generation was his number 3 strategic priority, as the Chairman alluded to earlier on. However, there were no concrete proposals provided to the committee, and this is not factored into the figures in the paper provided to the committee today. Does the Department have any concrete proposals for income generation for the 2015-16 year? And if so, what are they, and how much income could each of them generate?
At this stage, we don't have any concrete proposals. It's an area that we want to focus on and do some analysis, but
Nothing at all?
Nothing at this stage, no.
Okay. And finally, and this is always something close to my own heart, what are you doing to address the historic underfunding for mental health and learning disability services? Would you not agree that proper investment in these cases would improve health outcomes and probably save money all year round?
I think, yes, it is an issue. Again, I think from memory it was an issue that the Minister touched on and indicated his own personal support for that area.
Yeah.
That's clearly an area that we look at the appropriate level of investment as we finalise the budget position.
Right. Thank you very much. Thanks, Chair.
Thank you, Kieran. Rosie, had you indicated you wanted in at this point?
Well, I have a couple of other questions, but I'm not sure if
Did you have to leave, or are you okay?
I don't need to
You're
leave
okay,
now, so-
okay, grand, okay. So Paula's next then.
If I go back to your paper and we go to paragraph 9 again, and we're looking at the salaries and wages, and there are the figures for 2012-2013, and I mean we all fully understand that we have committed expenditure, and that's we've no choice in that one really. That has to be there. Do we have figures yet for 13-14?
Not quite. Those will be available just certainly this side of Christmas. They're nearly.
Okay, so we will then know if there's any difference in spend, or do you expect there to be much difference in spend?
We wouldn't expect it to move significantly, given this. I mean, you're going from 2.23 billion there. It'll not move significantly as a proportion of the overall budget.
You had also talked earlier, Julie, about flexibilities in staffing, and that you spoke about locums and agency nurses, and then we also spoke about the impact. But yet on the savings part, when you go to paragraph 17, we have savings under staff productivity is a reduction in backfill while still remaining safe staffing levels. I know a lot of that backfill is being used by agency staff and locums. So realistically, do you think that is going to pose a great difficulty, that flexibility?
Part of that is about looking to see whether potentially you can take your level of agency resource down and actually bring in permanent, and that by doing so maintain the service, and but also potentially do that at a reduced cost. So if we can take agency down, you're looking to see, well, what do those agency staff support, and is there a more cost-effective way of doing that? And it may well be that bringing in a permanent member of staff is a better option. So that's what that is asking the question about, and we would want Trust to consider that.
Because we would know, I know from coming from a hospital background, and I also know from visiting hospitals, a lot of the agency staff are actually the staff from that hospital that then go in to do banking, and it's the same with the locum doctors as well. You know, and there are people who would like permanent positions out there. You know, so that sounds like a much better plan to have.
Absolutely, and certainly the Trust would wish to encourage the use of bank rather than agency as a first call. And to be fair, there would always, though, be an element of agency or bank. You need to maintain an element of flex on the workforce, so it will never reduce completely.
Yeah, and I know we need to allow for, there's various things that can happen due to sickness levels, could be any number of things where you have to pull in and understand that. On another point, you mentioned in the last meeting about the Clinical Excellence Awards, and it's a bit of a sticking point with a lot of us, this one. You mentioned about the consultation being launched. Has it been launched yet? Is there a date for the launch? Or?
It's not launched as, but I understand it's very close to being launched.
Okay, and do you have a time frame yet of how long the consultation will be and when we're likely to get a result on that?
No, I don't know that, Canon.
We'll check out.
And one final question on that. In your estimate budget for 15-16, has that been included in the, I assume it goes into salaries as well?
I think, to be fair, what you've got is that some people will be contractually entitled to them, and then what you can look at is new awards, and we will be most definitely looking at that as an opportunity further forward, but needs to be set then aside alongside other proposals as well. But there will be an element of contractual entitlement there, where, like anything else, you have to pay what you're contractually entitled to.
So the contractual part is included then in what we're budgeting for, but as you say, any new awards aren't then, I take it?
Well, we
That's
would be looking to see what
discussing at a later date.
It's certainly something that we would look to understand what we can do in that space.
Okay, thank you. Thank you, Chair.
Thank you, Paula. And Gordon?
Thanks, Chair, and thanks very much, Richard. Could you just clarify a couple of points on the £80 million that you've received this year to keep services going? The 80 million that we talked about. We got a quick breakdown the last meeting. We didn't get an awful lot of detail on that. Have you any further information on it? There was issues like safety and quality initiative. What does that mean?
There is, if it's useful at this point, just to say to the member and yourself, there is a response in the pack from, I don't know if it's in the table, it's in the table paper, sorry, Gordon, just today, a response from the Department and the Minister in relation to that breakdown, which we will be coming to. Because what we're dealing with today is 15-16 going forward, so I think we can come back to that as the meeting goes on.
Okay. Yes, safety and quality. £4 million is in there. What does that mean?
Sorry, Chairman.
But again, I think we need to be clear, Gordon, because what we're dealing with here is the budget 15-16. That was the October monitoring round. And I think we can pick up on that as the meeting moves on. If members, because this table paper will be coming up under correspondence or matters arising.
It's 80 million, I know that what we heard so much about was 20 and then 60. Have you anything further than that, Gina? Or do you not know what the money's for?
They won't, sorry, Gordon, and I'm going to say it again, they won't, in fairness, have that information, because they're not here today to discuss it.
I don't want to be unfair to the committee and take a stab at answering your question.
No, don't. No, don't.
You don't know then what it's for?
We don't have the information with us because we prepared to come today to talk about 15-16.
It was on the agenda last meeting. We got very little information on it.
Yeah, and that's why we have a response back today, which we can reflect on later on.
I'll move on.
Okay.
Could I raise a few points I mentioned last week? The proposed closures at Bangor. Have you any further thoughts on that? I know you probably haven't came to talk about that either, but we are responsible for the budget, and obviously it's budget driven. Bangor, the proposal there to save 67,000 on closing.
And I'm going to have to, with respect to the member, close that down, because that's not.
Is there any, can I just ask a question, Chair? After all, I am elected.
Well, no, absolutely, and I
yeah.
don't dispute
Appreciate that, yeah.
No, I don't dispute that, Mr Dunn. I don't dispute that. But however, we have a very clear, specific agenda today, which is the budget 15-16 going
Is there any
forward.
further then? Have you had any further thoughts about
Sorry,
about the reduction of expenditure within the South
I've made my views known, sorry, Mr Dunn, and I'm standing over this. The department aren't here to discuss that today. We can certainly, and I'm given flexibility here, we can pick up on those issues and the monitoring round going forward, but they're not the remit of the department today to discuss, and that's final. I'm just going to move on. Okay, Rosie, I think on the capital and the change fund specifically.
Carly. It's in relation to the capital budget. The paper details a list of high priority projects that you'd like to progress but which are not yet actually committed. Can I ask you, how were these projects determined as priorities? Who selected them?
Sorry, I'm sorry, I missed the last bit of your question. Sorry.
Right, the paper details a list of high priority projects you would like to progress but which are not yet contractually committed. Can I just ask how they were determined as priorities? What was the process and who selected them?
Do you want to talk to me? There is quite a long process.
That in terms of how priorities are gathered together, we would talk to all bodies, obviously to the trusts, about what they would wish to happen within their areas. There's discussions with the Commissioner, brought then together within the department, and then discussions with the Minister. Some with capital, you'll appreciate that there is normally a long lead-in time to the projects. So these ones that are on the high priorities projects but not yet actually committed will probably be well in process. There will be business cases, for example, already well done, but they just haven't got to the point in the procurement process where they've actually got a contract signed. So these, for example, like the Children's Hospital, are things that have an outline business case already signed up to and agreed, worked through that process that I've described in terms of how a priority is identified. And these ones are effectively just ready to go, ready to get into contract, ready to be signed off, and that's where we are in it. They're running through the various procurement processes.
And would you see anything maybe happening that might change that process?
In terms of how we identify priorities, I guess the point I would draw for the committee for 15-16 is there isn't a huge amount of resource available, if any, to take forward new priorities that we don't already know about. So absolutely we work right across the system to understand how capital can support and best deliver services and where those priorities are. We have reports available around the state of the estate and where we're actually at in terms of understanding our buildings and what needs to happen there. And so a combination of both an assessment of the actual status of a building alongside how would you potentially provide services in a new world as you move forward and try and effectively move services into maybe a different place or a different location. So the process in itself works. The problem at the minute for 15-16 is that there isn't a huge amount of money, if any, available for actually starting new projects that we are not aware of at this point. So we are working, as we already discussed, around the contractually committed projects. Those will happen. We then have to manage these other high priority projects for which we have already got business cases in place, and we need to get those kicked off. And then if and only if there's resources available, would you then be tackling effectively new projects coming in on that prioritisation process.
The only other point where it might change, all experience tells us that across the block some departments struggle to deliver capital projects. So the project that when we finish this process that we would like to take forward but are unable to, we will be keeping those warm in the event that halfway through the year, as happens quite frequently, DFP indicate to us that it was happened last year with DRD and the A5, that a big project somewhere else stalls, a lot of money is available for allocation. We want to make sure that we can move quickly if the opportunity arises in year capture any available funds and move quickly on some of those projects. So anything we can't start, we'll not be putting into cold storage. We'll keep it ready to go quickly.
Who is it that actually makes the decision on what the priorities? Who's the final?
Minister?
So it's the minister's choice at the end of the day of what's going to be the high priority. Okay. Can I just ask you about the Change Fund? That's just my final question. As we know, the Executive has agreed to allocate £30 million to a Change Fund. So is the Department intending to submit bids to that? And what would be the deadline for submitting bids?
I think there's a note just come out from colleagues in DFP. Is it the 5th of December?
No, I think it's the 12th of December. So we've literally only, the guidance has only come out tail end of last week. And yes, we would intend to commit to submit bids. We're not at that point. We've literally only just got the guidance. It's focused around proposals that are about reform, about where potentially you're working in partnership with other bodies, and where they've got preventative type approaches, and we would absolutely be keen to submit bids to that process. But we've literally only just got the guidance, and we're starting to commission a process around, well, what would that mean for us, and how would those bids play through?
Will TYC factor there?
There's if certainly when we consider the criteria against TYC, if we can make a bid on that basis, we would.
But, sorry, Rosalie.
Go ahead. No, go on ahead.
Yeah. Would that not be right up TYC Street?
Absolutely.
Yes.
Would you have a raft of stuff that you could put in bid against?
I think we would have quite a few proposals that we could put forward to this fund. We need to pick, obviously, the work through the process, establish effectively what those proposals are, and then submit them.
What type of proposals?
Well, you can look at, I mean, I think the committee has mentioned quite a few of them already. Certainly the likes of TYC, the likes of public health is also in this space in terms of preventative measures. Some children's services, I'm sure, would see themselves as being reforming and in partnership.
No, but what proposals within TYC would you be prioritising?
We would be looking to the ICPs and the processes that we've got to identify which of the initiatives that they would like to put in place best fit against the criteria. But we've only literally got the criteria at the tail end of last week.
I think that the trick with us is the criteria, right? There's only 30 million across the block. It will be very competitive, so we want to make sure that the bids we select to put in are as competitive as possible against each. And one of the particular is partnership, working with others. We need to think to make sure we give our bids the maximum chance of success in this. So, we need to.
I'm guessing that there should be a shelf load of stuff sitting in the TYC boardroom room. Not being facetious.
Okay. Well, thank you both.
Thank you.
Chair, can I just ask a question?
Yeah.
Am I allowed to ask questions? Yeah.
Mr. Dunn, of course, you are, if it's relevant to the debate.
To clarify a point I think is important, the role of the trust in relation to this, how do you evaluate the proposals of the trust?
Well, they're firstly looked at by the board in terms of their commissioning role. The board will form a view, and then we'll have a heavy dialogue. So it's not that sort of do it by numbers that we apply weightings to every criteria. We look at it in the round, the issues they want to hit in the context of the PFG commitments, the minister's priorities, a whole range of implications. There's analysis by the board. There's a lot of detailed analysis and dialogue between us and the board, and some considerable scrutiny of them. I would say it's maybe more of an art than a science in terms of assessing, because there's quite a volume of material that comes from them. Lots of it is more qualitative than quantitative in nature. So it's that, to use that dreadful phrase, it's an iterative process and looking through it in dialogue and discussion.
And how do you assess the impact of change? Frontline services are the ones that affect the patient, affect our constituents, and have an impact, a huge impact within our system, within our communities, and the media like to latch onto them. Do you assess all of that in the difficult processes that you go through? And I think it's important, that you do look closely at that, because in all the good work that's done by the Trust and yourselves in delivery of health care, a lot of it is lost in all of this. the media try to change things, and the impact of it is totally out of proportion. So I think it's important in future that, that yourselves, the board and the trust, look at those issues closely and scrutinise them before such decisions are put forward to the Minister and to the Assembly and to the members here.
Well, I wouldn't want to leave you with a sense that there's anything other than a very heavy measure of scrutiny, particularly within each trust area, because the reality is each trust area knows their local makeup of population, service configuration, and in a context where we've talked today at length, as we did previously, about the need to ensure that the maximum amount of funding goes to the front line as opposed to administration, there does need to be some element of trust. That we can't create a structure whereby the board re-performs and second guesses each and every decision and piece of analysis by the trust, and likewise we do that. So there's a measure of mature engagement, but issues put forward by trusts are challenged. Assumptions are looked at by the board and by the department. The other bit that's relevant to this is it's not just any individual proposal in itself. It's also looking about what the alternative arrangements are, and alternative proposals that are never put out as things that will happen are often not put out for very good reasons, that they're even more painful than the proposals that we do have to implement. But I don't want to minimise the impact in areas of difficult and uncomfortable choices, but they're choices that have to be made given the financial environment.
And some of that is about understanding, particularly where patients are involved, where are the alternative places where care would be provided. Understanding first and foremost is the demand there, because it may be that the demand is not there and therefore you can adjust the service appropriately, but where the demand is still there, that there is an alternative provision made and that people are clear how they access that service and what that means. So absolutely it's about understanding for a particular patient and what actually is going on, and what would be the impact on that, on services as you move and make that change, and making sure that if there is an alternative, that has been worked through and understood and will be in place at the right time.
Okay, thanks very much. Thank you.
Thank you, and thank you both for that. Obviously, we'll be reflecting on the information today, and I think it was important because I think for the first time we were talking about the discretionary and statutory obligations, and I think that's an important conversation going forward. And I think it's, if I may comment, just irregular that we don't have a definition of what frontline services is, however, when we're aspiring to protect those. But we will reflect on what we heard today, and I do thank you both for your time. Thank you. Okay, members, moving on to item 7, which is the Food Hygiene Rating Bill. It's a briefing by Assembly Researcher initially. Refer members to page 139 of your meeting folder, which is the Assembly Research paper on the bill. Want to inform members that there is a bill folder that has been circulated for each member. These folders need to be left on the tables after each meeting, and committee staff will collect them and update them as necessary. Just advising members that Committee Researcher is here today to brief members on the research paper on the Food Hygiene Bill. And Tim, you're very welcome.
Thank you.
So I'm going to hand straight over to yourself, and then I'm going to invite questions from members.
Thank you, Chair. I'm sure all members are aware that the Research and Information Service prepares a research paper for every bill going through the Assembly, and I'm sure you've got a copy in your packs. I don't intend to go through the paper in any detail. It's a comprehensive coverage of the bill, but what I will try to do for the committee is set out what the aims of the bill are, how the bill seeks to achieve those aims, and look specifically at who is covered by the legislation, what they're going to have to do, what happens if they don't do what they're required to do, and what protections they have under the legislation. So if we could start by looking at the aims of the legislation. There are some figures in the paper, and they're probably well known to the committee from previous briefings. 48,000 cases of foodborne illness in Northern Ireland annually, 450 hospitalisations annually, 20 deaths, and an estimated cost of 83 million from foodborne illness. And the whole thrust of this bill is to reduce foodborne illness. That's the overall aim. In terms of those figures, they're probably a large underestimate. Not everybody who gets food poisoning goes near a doctor. But it's also worth pointing out that the bill is not attempting to address all the causes of foodborne illness, and that councils can take direct actions against establishments where they need to close them or have stricter enforcement. The assessment of the impact of the bill is that it would reduce the number of cases of food poisoning by 500 a year, and that would lead to a saving of around £900,000. So that's the overall aim. How the bill seeks to achieve this aim is to create a virtuous circle. Councils, when they inspect establishments, will be required to feed back to the establishments what their food hygiene rating is. The establishment will then be required to display this rating, and the theory is that customers will seek out establishments which have a higher rating, and this will drive other businesses to try and improve their rating. So it's a virtuous cycle that the legislation is trying to create. It's a relatively short bill, 20 clauses and 1 schedule, but it's a bill which has got a significant number of secondary legislation making powers, and those are set out in the research paper in a table. I should say that there was one omission from that table, and there's one small change that we'll make and provide members with a revised copy. I can detail those later. The bill is similar in many ways to legislation which has been in place in Wales since November 2013, and some of the comments I will be making will be based on the Welsh legislation. There's no similar rating scheme in place in the south, and there's a slightly different scheme working in Scotland, and there's legislation going through the Scottish Parliament at the moment. So that's the background to how the bill will work. So who is covered by the bill? The bill talks about food business establishments, and in clause 1, I'm sure members have a copy of the bill. In clause 1, they set out what a food business establishment is, and there are 2 elements to this. And the first element is that businesses or establishments which have to register with their local councils under European food safety laws, they're all covered. But then it says that it's only those businesses or those establishments which supply food direct to customers. So those are the ones who are the businesses who are considered food business establishments, and the bill relates to them. And it's probably worth pointing out that there must be a large or some size of a group who are registered with the council but who don't fall within that second category of supplying food direct to consumers, and members may wish to follow up on who those businesses might be. One group is probably businesses which supply food to another business, and those are included in the Welsh legislation. They're not included in our bill. The department has a power to amend the definition, so they could amend the definition and include those or any other establishment that falls within the first criteria. The department may also, under clause 1, exempt certain businesses, and the Welsh legislation's ahead of us in terms of they've made regulations, and what the type of business they have exempted are businesses which are not there solely to provide food, and where the food is packaged when it arrives and packaged when it leaves the shop. And there's a few more requirements there, and I won't go into those in detail. Childminders, that's another group which are excluded under the Welsh legislation, and there are some bodies or some establishments which are involved in the care of people which are also exempt. And again, so the department has a power to exempt businesses here, but again, that's not on the face of the bill. And finally, in terms of who's covered by the bill in clause 13 makes special provision in relation to mobile establishments. So your fish and chip van that travels around, that type of establishment will be covered, and that's in clause 13. In terms of what the establishments who fall within the definition of a food business establishment have to do, what they have to do is display the sticker that they will get from the council following an examination of their food hygiene rating. Members will, I'm sure, know that at the moment there's a voluntary scheme in place, and I think 57% is the average display rate. It goes up if you've got a good rating, and it goes down predictably if you've got a poor rating. I think it's around about 13% for those in the lowest categories. So what the legislation does in Clause 7 is it makes it a duty to display your sticker with your rating. And if we go back then to the secondary legislation making part, what that sticker will look like, where you will have to stick it, and how it will have to be displayed will all be set out in regulations. I think in the paper, in the bill paper, we have some examples of stickers on page 7, 7, 8 and 9 in the bill paper. And I think the Welsh, what they have done is they've added in the logo of the National Assembly for Wales onto the sticker. Something might be considered here. But it's the rating from 0 to 6. And I think from the regulations, it's about the size of an A4 piece of paper. Members will see on page 9 that we've got the Scottish system, which is simply a pass or an improvement required. And we know from other jurisdictions that they use smiley faces rather than numbers. But all of those things can be determined in the regulations when they come through. There's also a duty to provide information orally. So if an establishment asks what the rating is, there's a duty to tell people, and that's obviously if somebody's blind, they're not going to see the sticker, so it's important that they have a way of finding that out. Also, if you make a telephone call and you order food on the phone, you could ask what the rating is. So there's a duty to do that. What there isn't a duty to do, and which there is in Wales, is a duty to promote the ratings. And I think the way they've used this in Wales is in terms of internet orders. So if you imagine you go online to Nifty Nosh and you order your kebab, it goes straight through to the shop. They prepare it. In that scenario, you don't know the rating till you go and pick it up, and they're not going to be particularly pleased if you say, well, no, I'm not happy with the rating, I don't want it. So what they've done in Wales is they've used the duty to promote ratings to say that on your website or on any electronic communications, you don't have your rating because that could change. But what you have is a link, or you direct people towards the Food Safety Agency's website, which will have the rating. So that's the way they've got around that. Those are the duties. What happens if you don't do what you have to under those duties? Well, under Clause 10 of the bill sets out offences, and I think the offence is up to level 3 on the standard scale, which I think is around £1,000. There's also provision within the bill for fixed penalty notices, which can be used by the local authorities to enforce compliance. I think one of the differences is the money from the fixed penalty notices, I think in Wales, goes to the Welsh Government, whereas here it will go to the local councils, as I understand it. That's another difference. In terms of what protections establishments have in terms of the rating itself, they can appeal, they can ask for a re-rating, or they have a right of reply. And Clause 3 deals with appeals. And there's one ground only for appeal, and that is that the rating does not reflect the standards at the time of inspection. The Welsh legislation provides a second ground for appeal, which is that the criteria weren't applied properly during the inspection, but we only have the one ground. In terms of the independence of appeals, the bill provides that they will be heard by the same district council that carried out the first rating, but by different officers, so you won't have the same person involved in the rating, and whether that's sufficient independence is a matter I'm sure the committee will want to consider. An establishment can ask for a re-rating, and I think there was some discussion around the timescales for re-ratings. Councils were concerned that they would like a longer time scale, whereas businesses said we want to be able to get a quick re-rating if we come out negatively. This is Clause 4. And I think that the business establishments won the day, and there is, if a business asks for a re-rating, that has to be done, the visit has to be done within 3 months, and then within a further 2 weeks they have to be told of what the re-rating is, and businesses will have to pay for those re-ratings, which is probably why the timescale is quite short. The third sort of protection for businesses is a right of reply, so that when a rating is provided to the FSA, the business can add its commentary, and that will be submitted in certain circumstances to the FSA. And where it's not submitted to the FSA, the local authority will have to give a reason why not. And then just the last point, the bill contains a clause which provides for review of the legislation. So after 3 years, the FSA will have to carry out a review of how it's been working. And with that, I'll finish and take any question.
Okay, thank you, Tim, for that. Very useful. Did you say that you talked about savings of, was it 900,000?
Yeah, it was an estimate of 500 cases
500 cases.
fewer and 900,000.
Okay.
And I'm not sure how that's worked out. You could maybe ask.
And to see just in terms of the consultation itself, and one of the issues that was coming out was the appeal process. And, you know, I think from what I'm looking at here, there's obviously support for an appeals process or appeals mechanism, but for it to be a longer period, is that now covered?
In terms of the extent at which point you can actually make an appeal, I have to say I'm not sure. That's maybe one for the
I think there was
FSA.
something about 14-day appeal, but now it's the bill reflecting that it's 21 days.
I'm sure you're right.
I suppose as well there's a point about, whilst this is proper and correct, but it's not making businesses jump through any more hurdles than they have to in a struggling climate.
No, I think the inspections will take place regardless of this legislation. What this simply does is make them display the rating and also to inform people if they ask. So there shouldn't be any additional burden, except that if they feel that customers are following the good ratings, they will want to quickly do something to change their rating. That's the theory.
Okay. And then you see, just in terms, I know you referenced Wales but has there been analysis there of the right fit in terms of legislation? You talked about Scotland's been slightly different, but
I mean, it's modelled. Our legislation here is modelled very closely on the Welsh example, and November 2013, most of it came into force. It's probably not long enough to actually know how effective it's been.
Okay, thank you, Tim. I think Paula had indicated.
Well, I'll wait until there's.
Go ahead.
It was just on the issue to do with, you talked about the internet and about, has it been looked at yet? I mean, if we look in any of our kitchen drawers at home, we will have menus for a plethora of places. I know I certainly do in my house. But, you know, has that been looked at anywhere else about having to put it on? That's quite often what we use. You know, when say fancy carry out, you open the drawer and go through them.
Oh, absolutely. One of the reasons why the Welsh decided not to require it on publicity materials was that those go out of date, and exactly you have them lying around the house, and you've maybe won. The prices might not be right, but it's the same menu you've had for 2 years, and the rating could have changed. So what they said was, what we want you to do is on any menus or on electronic communications, tell people that they can get the up-to-date rating on the FSA website.
It probably needs to go slightly further in that, in the fact that it needs to be, you know, on it as a blank one even, so people are aware to ask, because a lot of people won't.
Can I just jump in there? I had written down here, could or should the rating be printed on carry-out bags or packages? In other words, beans cooked, you've made the call in, you get it delivered to your home, and there's a sticker on it saying it's a 5. Is that being examined?
That hasn't been examined, but I think the same argument would apply that if a business has to buy 5,000 bags because it's cheaper to do it that way,
Would it put
and the rating change,
sticker on
sticker,
the bag?
that I haven't heard of that, but it's one to raise with the next witnesses.
Paula, are you okay?
Just
yeah, and Gordon?
Thanks, Chair. Thanks very much. Do you see this as an accreditation process?
I don't think it is an accreditation process, because the inspections happen, the rating happens, and what this bill simply does is say you've got to put that rating somewhere yet to be determined, where the public can see it, and on that basis they can make a decision. But the ratings are there.
Yeah. But just, I suppose I'm getting more into the processes, but how do you know there's a consistent assessment across the various establishments if you don't have standards as such?
I don't know how you do establish that, and it's one for the FSA.
Right.
But it is that if you think that the Welsh legislation does allow you to appeal on the grounds that the criteria weren't properly applied, that would seem to get to your point that you could actually appeal on that ground, not that it didn't reflect the hygiene in your business, which is what we have provision for.
Are there standards as such for food hygiene within this food establishment? Written standards?
Yes, I'm pretty sure they are, and I think they probably derive from the European food safety legislation, which is referenced. But again, the FSA are in a much
I think
better
we can tease that out.
place
then,
to answer that question than me.
And council resources, are council resources going to be increased to manage this?
I don't think there's any money available for councils. I know councils were concerned that the timing of this might not be great with new councils coming into place, and I know they were concerned about the re-ratings, that if they had to be done quickly, they would be under pressure.
Okay, thank you.
Okay,
Thanks.
thank you, Gordon, for that. Okay, Pam,
It was
sorry.
just on the, because you were discussing the kind of the online and the for bags and menus and stuff, and you talked about the displaying the link to the website,
Yeah.
which really, you know, when you're hungry, you're not going to go to another website. You're going to stay on the same page. But I don't see. I kind of, when you look at the food industry now, and I'm quite sure, I know there's certain businesses who might even do the majority of their business actually online and through apps. And I think that the rating should be displayed exactly as it would be physically on a building, on a door, on a window. I think it's absolutely necessary that it should be displayed on the web page, the actual rating, and not a link. Because to me that's probably easier to change than physically standing up and pulling a sticker off a window and putting another one back on. I think it's probably easier to change. I don't think that would be a difficulty, and I think because of the way people purchase food now, that's essential.
Yeah. Well, we don't
That's in
have
my opinion, of course.
the duty to promote, which is been used by in Wales, isn't in our bills. That would be something you'd have to have that included in.
Added in.
And the one thing I'm not sure about is if there is somewhere like Nifty Nosh, which services a whole range of businesses, which business do they order from establishment X? You go through this central. I'm not sure which one they would display, or whether when you went through to the order they would have to. I'm not the technicality. I'm not sure how it would work, but yeah, most people do order online, and maybe an app is the answer, where you could just type in the name of the place and it would tell you what the rating was.
Okay, thank you. And Joanne on this, yeah.
Thanks, Chair. Apologies, I've missed the start of your briefing if this already has been raised. I was wondering about your views on the displaying the ratings for practical proposals for people that are visually impaired about the standard. And are you aware, has there been any best practice during the voluntary displaying where companies communicate their ratings to visually impaired people? Has that been?
I'm not sure about best practice, but there is a duty in this bill that you have to, the operator of the business and has to ensure that their staff provide an oral answer when somebody asks about their rating. So, and I think that's deliberately there for people who are visually impaired.
Okay, I do. Yeah, Rosie.
Can I just ask a small question? Will there be the option in the consultation for the type of rating? So it seems to be like the 0 to 5 is the popular one, or the Scottish model. Would that be available?
The rating scheme won't change, but whether you could change, the sticker could change, now and you could say that a 0 to 3 is an unacceptable, or above a 3 is a pass. I'm not sure whether that's possible. That's one for the FSA, but 0 to 6 or 0 to 5 is quite. Luckily, the 0's there. Otherwise, you would think 1 was the best. But whether that confuses people, I'm not sure.
Okay.
That's okay.
Okay, thank you very much, Tom. Very useful. Thank you.
Don't.
Members, I'm moving on to item 8. I'm conscious of time. This is a briefing now with the Food Standards Agency. We have representatives here today. The briefing is based on the bill itself, so there's no briefing paper obviously required. I'm going to ask members to, where possible, well, it should be possible, to be concise with your questions, and I'm going to make the same appeal to the witnesses as well, in the interest of time. Carol said. Okay, and today we have Michael Jackson, who's the head of the Local Authority Policy and Delivery Food Standards Agency, and Catherine Baker, Head of Consumer Protection at the Food Standards Agency. You're very welcome. I'm saying, folks, this is obviously the first conversation we're having around the clause-by-clause approach. I'm going to ask you to be as succinct as you can in relation to answering questions, and I've asked members to do the same. I'm going to ask you to make opening comments.
Thank you very much for inviting us along today to talk to you about the bill. You've just received a very helpful introduction around some of the key aspects of the bill, so we'll try and cut back on our discussion on those, but to point out a couple of key issues to help you understand the basis on which the whole scheme has been developed. And then in talking through the clauses, we'll try and highlight why some of the particular aspects are there and what they mean in practical terms, if they haven't already been covered by Tim. You're very well aware of the position with the voluntary scheme, where we've got around 65% of our high-rated businesses displaying, but only 23% of those with 1 and 2 ratings displaying, and only 40% of businesses were actually putting their sticker in a place where it is visible from the outside of the business. So this is the basic reason why we're trying to move forward with this bill. That we'll have a system in place whereby businesses will be required to display their sticker. I brought one just so you can see one in the flesh today. This is an actual sticker, that's the size. Front has the rating, this is a 5 one with the very good, and on the reverse there are details about the date of inspection, date of issue and so on, which are part of the validation and authenticity of the particular rating. In terms of how we have gone about the approach to the bill, we've very much taken the approach that it's developed on the basis of not replicating requirements which sit elsewhere. Tim mentioned to you that the rating system was driven by the inspection regime that operates. And basically, the inspection regime that is delivered by councils is already set out in European regulations, and this is implemented by all district councils. The detailed requirements for how inspections are conducted, when they have to be carried out, depending on risk and compliance, is all laid out in what's known as the Food Law Code of Practice for Northern Ireland. And that's a statutory code which is signed off by the Minister each time that it is reviewed. So in practice, it's this code which drives the plant hygiene inspections. And it's the information that is gathered from the inspections that's used to calculate the rating. And you'll get a good insight into how an inspection is carried out and how those findings are then used to produce the rating when we do the visit to the kitchens here in Parliament Buildings next week with the food safety officers from Belfast City Council. But in essence, what goes to the heart of the scheme is that the food hygiene rating is built on work that is already being done by the councils to fulfil their statutory duties to comply with European legislation and to protect public health. And all that this scheme does is require this to be displayed, and that's the sum total, really, in reality, of the burden of sticker, which will be provided by the FSA, which the business displays. So in terms of the approach that we have taken, it minimises the burdens that would arise from introducing a requirement. Okay. The detailed operation of the current voluntary scheme is laid down in guidance which was developed between Food Standards Agency, local authorities and industry around the UK, and that guidance currently sits in a document called the Brand Standard. So again, this framework is all laid out as to the mechanisms that run in the background to allow the ratings to be developed. And indeed, there was reference to the fact that this bill has been developed along the lines of the scheme in Wales. The bill has been developed along the lines of the voluntary scheme that currently operates across, that operated originally in England, Wales and Northern Ireland. So we have the same 0 to 5 scheme operating in those 3 countries. That's where we started from. Wales have now put the same scheme on a statutory footing, and that's what it is we're trying to take forward in Northern Ireland. The basis is of the voluntary scheme that was already in place. Turning now to the clauses, and I'll try and cover these as quickly as possible for you. I've already explained how the information is gathered from the routine inspections, and you are aware that the ratings are currently proposed to be awarded to those businesses which supply food directly to the consumer. So the types of business which doesn't receive a rating would be wholesalers, food processors and manufacturers, and those places which are not directly open to the public. And the reason for that is that the whole purpose of having the rating sticker displayed is so that consumers can make informed choices at the point at which they make the decision to purchase food or to eat out. That's the logic in which the food hygiene rating scheme was originally built. You may have noted from subclause 1.2 that councils are not required to prepare a rating on every occasion, and you may be wondering why that would be the case. Well, that's there to take account of the fact that the councils carry out other inspections, not just the planned inspection, which is set through the Code of Practice. So, for example, if a planned inspection takes place and the food safety officer finds that conditions are not good, they will arrange to conduct a further visit within a short space of time to make sure the business has taken the necessary action. So because there are these range of visits, it's not necessary or indeed appropriate to be awarding a rating every time a visit is made to the premises. The rating is primarily driven by the planned inspection or the re-rating if the business asks for one whenever they've carried out the necessary work. At this stage, I'll hand over to Catherine, and she will take you through the next set of clauses.
Yes, I just want to take us through Clause 2, quickly up to Clause 8. So Clause 2, just turning to Clause 2, deals with notifying the rating and publication of it. Clause 2 requires the District Councils to notify ratings to operators within 14 days of conducting their inspection, and this has to be accompanied by certain other information. So this includes the sticker itself, but also the reasons for the rating, along with information detailing any improvements that that business might need to make to comply and obviously improve their rating, and an explanation of the safeguards that they have available to them. And in addition to notifying the operator, the councils also have to let the Food Standards Agency know, and this is so the information can then be published on the website. So within the current voluntary scheme, there's a very small number of circumstances where this information, the rating, isn't actually put up onto the website, and this really just relates to Ministry of Defence establishments, and it's where there might be security implications about publishing addresses. So you'll see there we have subclause 4, which takes account of that, and we would anticipate that that sort of detailed guidance would then sit within an equivalent guidance document to the brand standard. Subclause 2 provides a regulation-making power, and this is to prescribe the form of the sticker which Michael has shown you. And it's intended that the format and the look of the sticker that you've seen today would remain exactly the same. The intention would be for that within the statutory scheme. So looking at Clause 3, appeal, this clause provides the first of the safeguards for businesses. It provides the operators with the right to appeal their rating, and the intention is that they could make one appeal. This would need to be in writing, and it would be to the council that produced the rating, and they would need to do that within 21 days of receiving the rating. There was a bit of discussion there about the difference between the Wales and the Northern Ireland bill in terms of the grounds, and in the bill in front of you, you'll see that the appeal can only be made on the ground that the rating does not reflect the hygiene standards at the time of the inspection. We consider actually the way the legislation is drafted here, it covers both circumstances that are included in the Wales Bill, irrespective of if it's what the officer have seen or how they have used the guidance to produce the rating. That wouldn't reflect the standards at the time. So we think our one ground encapsulates basically what Wales also have drafted. To provide a greater independence within the appeals system, the bill does set out in clause 3 that anybody who was involved in producing the original rating can't then be involved in determining the appeal. So in terms of the obligations then on the councils, once they receive this appeal, they also have to determine and communicate the outcome of that within 21 days. There was a bit of discussion earlier about the time periods, and they have indeed changed from the voluntary scheme, and they have increased, both for the businesses in terms of the time they have from 14 to 21 days to make an appeal. This was following the consultation responses, but also for the councils themselves to determine the appeal. Again, it was in response to the consultation responses. Just finally, in the appeal section, to point out subclause 10, which again provides a regulation-making power. And this is to provide for an appeal to be determined by another person other than the district council that produced the rating. And again, this has been put in response to the consultation, because a number of respondents came back and queried whether there was sufficient independent scrutiny within the process if the same council that produced the rating then subsequently determined the appeal. So, following discussions with stakeholders around the time of the consultation, it was determined that the appeals process should continue as it did under the voluntary scheme. However, the FSA should be obliged to review that, see how it's working, and determine then, based on how the statutory scheme actually operated, whether any changes would be needed. So the bill provides the flexibility within that clause. Members might wish to know that a similar provision also exists within the Welsh Bill, and similar discussions were had around this at the committee stage. Moving on to clause 4, the request for re-rating. This is the second of the safeguards for business, and it obviously provides them with a right to request a re-rating, which can be made after the appeal period. The request has to be in writing. It must include an explanation of the steps they've taken to improve, and it must be accompanied by a fee. And subclause 5C provides a regulation-making power to specify the fee. And again, further to views expressed during the consultation, there was very clear views from all parties that this needed to be a level fee across Northern Ireland, not different fees depending on which council area you were located. And we would propose to consult further with stakeholders on the level of the fee following a cost-benefit analysis. But again, for your information, the fee that has been set in Wales is £150. So the Council's obligations then are that within 3 months of receiving this request, they should conduct an inspection and review the rating. And again, it's worth just pointing out at this time that this is a change from the current voluntary scheme, and I'm sure you'll hear from other stakeholders when they come to speak to you around this issue, particularly the district councils, because within the current voluntary scheme, businesses cannot receive that re-rating inspection in the first 3 months after the original inspection, and it's commonly referred to in the current scheme as a standstill period. And you'll see within this clause that the standstill period doesn't feature. Again, this has been in response to the consultation. Industry expressed the view that waiting 3 months before you can even ask for the re-rating inspection, which could be another 3 months, was really too long for them to wait. And to encourage businesses to improve, this should be carried out quicker so that really they could benefit from their investment earlier. The clause does provide that the council can decide not to complete a re-rating. And again, you might be asking yourself, why would a council decide not to do that? But it's only where the bill itself is not being complied with, and you'll see that detailed in subclause 7. So, for example, a district council may decide not to do the re-rating where an operator is not displaying the rating. They're choosing not to display it for the consumers to see, or where they just have not provided the information about any improvements that they've made. So, turning just to the right of reply, and this is in clause 5 of the bill, it allows the operators, as has been said, to make a written reply, and you might kind of be wondering what does that actually mean and what it would look like. So I thought I would read you out two examples that are currently provided on the website that businesses have made statements that they've asked to be put onto the website. These are both for businesses that were rated 1 at the time when they made the comment. So the first one is, the conditions found at the time of the inspection were not typical of the normal conditions maintained at the establishment. The Environmental Health Officer has visited the premises and confirmed that we've carried out all works to their satisfaction. We are currently waiting a revisit for re-rating and are confident our rating will increase. And the second one, the conditions found at the time of inspection were not typical of the normal conditions maintained at the establishment and arose because the head chef had left. The new head chef had not been appointed and the kitchen was not being managed properly by the temporary supervisor. Since the appointment of the new head chef, health and safety procedures have been fully restored and all the staff have been trained.
They got a new sign with top marks.
Once they put their request in for a re-rating, and they have made all the changes, yes. Just to say, the bill does provide for the councils to amend or to edit any responses, and the purpose really of that is to take out information that is actually misleading or isn't true or inaccurate, or any defamatory remarks that might be made against an officer or somebody of the council. But at that point then, when it has been rectified, it will be published on the Food Standards Agency website. Just moving to clause 6 and 7, and these two sections are quite difficult to read. I do understand if you look at them and you think they're quite dense, but they're very closely interconnected, so I'll take the two of them together. It's clause 7 itself which places the duty on the operators to display the valid sticker. And subclause 1 provides a regulation-making power, so the manner and location would be specified in regulations. We did seek views during the consultation about what stakeholders' views were on where the rating should be displayed, and some common principles were expressed and came out of the consultation. They were that the display needed to be seen from outside before entering the premises, so for example at an entrance door or window, and approximately eye level height. But a lot of people did recognise that that is actually going to be difficult in some circumstances and will present some challenges. So just to draw your attention to some examples, they could be where an outlet doesn't have a traditional entrance, so maybe a very large retailer. Outlets in food courts, where you go into the food court and there's many outlets there. Also market stalls and mobile traders. And we therefore consider that it would be maybe prudent to detail more provisions within regulations and to give very clear guidance around this to business and enforcement officers, and obviously to consult further on more the detailed provisions for that. Clause 6 then just sets out when the rating and the sticker itself becomes valid and when they're not valid. And the rating will become valid as soon as the operator receives it, but it does continue to be valid until they receive their new rating and the appeal period has expired. So what this means in practice is that once an operator gets a new rating, in their 21-day appeal period, they can choose to display either the existing rating or the rating they have just received. And there's a good reason for this. You need to remember that they still have their right to appeal that new rating, and they may appeal it and it may be upheld that it shouldn't change. So it wouldn't be justified to impose on them to display a rating that might have subsequently changed on appeal. Subclause 2 just then sets down that the rating ceases to be valid when the establishment closes. And also another example is where maybe enforcement action is being taken, like an emergency prohibition notice, because of issues, food safety and hygiene issues found. So my last bit just to mention is the duty to provide information about the rating. And this is the oral information, and it requires the operator or a relevant employee to orally inform persons where the rating is requested. And as has been discussed, the purpose of this is really to inform anybody who may be partially sighted or blind. But it's also there for anybody making a telephone order at a takeaway, for example, so they can ask for that. A relevant employee is really just a person who, in the opinion of the operator, is likely to be asked for the information. So considering very big businesses with hundreds of employees, that might be the customer services section. In a smaller business, it will be people taking telephone orders and serving at customers. And again, we would anticipate providing a bit more detail and guidance to help people understand and take that on.
Okay.
Okay, turning then to clauses 9 to 11, which are for enforcement of the bill. Clause 9 is probably one of the more straightforward clauses that we have to deal with, and that requires the district councils to enforce the bill and give them powers of entry to enforce it, to make sure that, to establish whether businesses have complied with their duty to display, and indeed whether they've complied with their requirement to provide information orally where that has been requested. Clause 10 specifies a number of offences covering failure to display a valid rating sticker or displaying a non-valid rating sticker, failure to orally inform a person of the rating when requested, intentionally altering, defacing or tampering a sticker, and that would apply not just to the food business operator but to any person who would undertake such an activity, and finally obstructing an officer in exercising their functions. Now, if you look at Clause 10 in detail, you may see something which here is a little bit strange, which talks about a reasonable excuse. A food business operator would not have committed an offence if they had a reasonable excuse for having done one of the aforementioned things. And the reason that that is there is that this is common where offences would otherwise be strict liability offences and could potentially be unfair to defendants. But it would be for a court to decide whether or not someone had a reasonable excuse when charged with an offence of this nature. And just to illustrate what that could look like, you could have a food business, say a hot food bar. Food business operator gets his new rating sticker, puts it up on the door as required to do, so at that point in time he fully complies. Late on a Friday night, a crowd of yahoos come in, somebody decides they're going to start a bit of vandalism, they pull the sticker off, and it disappears. Very quickly after that, the local food safety officer comes in to do the inspection and discovers the sticker isn't there. But because of the series of checks that the business would normally have in place, they haven't realised yet that it has been removed. So in that situation, they may be able to demonstrate a reasonable excuse, but it would be for the court to decide. Subclause 10.7 is the one which provides the level of fines in relation to an offence. That is currently put forward at level 3, which does have a maximum penalty of £1,000. And we are aware from the debate at second stage that this is a matter that members will probably wish to explore in some detail. Clause 11 then is the clause which allows for the issue of a fixed penalty notice where a business has failed to display a valid rating sticker or has displayed one that is not valid. The details of fixed penalties are contained within the schedule, and as Catherine highlighted, the amount of fixed penalty is not on the face of the bill and is intended that that would be set by order in due course. This level is consistent with the figure of £150, which Catherine mentioned, is consistent with what has been set in Wales. And as yet, through the operation of their scheme, it has not been necessary to issue many fixed penalty notices. They've actually, to date, issued quite a small number, less than 10, we believe, as of a couple of weeks ago. Clauses 12 to 15 provide for miscellaneous functions, and one of the issues there is around the fact that the power to allow inspection and rating of mobile establishments can be transferred from one district council to another. And this is purely to reflect the fact that current legislation requires that a mobile is registered in the area in which it's kept. So if someone operates 3 hot food vans and they keep them in their driveway in Carrickfergus, but they never actually trade in Carrickfergus, the food safety officers, when they go out to check the details of the business, they can look at the units and see that they're clean and in good repair, but they can't assess the actual hygiene procedures and practices that the operator applies whenever they're preparing food. Whereas whenever the unit is taken out and it goes into the council area where it trades, say for example, they come down into Belfast and they trade there, then the food safety officers, when they would carry out an inspection, they would be able to see the fine detail of what was going on. And in that situation, they'd be able to gather the full picture that would allow the rating to be calculated in a comprehensive manner. So that's the rationale in terms of allowing this duty to be transferred. You're also being made aware that there is a requirement in clause 14 for the FSA to review the operation of the bill within 3 years of commencement, and that is to make sure that the scheme is operating as intended. And some of the things that stakeholders were concerned about during the consultation haven't become a reality or don't in fact need to be addressed. So that's around the appeal process and the independence of that, how fixed penalty notices are issued in practice, and indeed district councils are concerned about the possibility of one re-rating inspection becoming a disproportionate burden on their ability to deliver the planned inspection programme, which is most important, to ensure that consumers are protected. The remaining clauses 16 to 19 contain some supplementary provisions and application of the bill to the Crown, and that's very important because obviously nowadays we have a lot of establishments which are on Crown property where the public do have access, and it's right and proper that they're able to make informed choices for those businesses as well.
Okay, thank you both for that. I mean, there's a number of people have indicated around specific clauses, so again, I'm going to appeal for questions and answers to be succinct as possible. I do appreciate you giving us that overview. In terms of clause 1, and I think you have touched on some of this, but specifically in clause 1, sub-clause 1, it states that the council must rate food businesses rather than the process we currently have around specifying around the rating from 0 to 5. Is there an explanation for that, or in your view?
Well, again, the reason that detail isn't included in the bill is because it is laid out in the guidance document which the councils currently use, and we would intend to replicate that in the statutory guidance that's provided for in the bill. And there certainly is no intention on our part to be changing the basis on which ratings are awarded. It's very much about moving the 0 to 5 ratings from the voluntary display to the statutory display.
Yeah, but I mean, you're talking about it being included in statutory guidance. Okay, and you have, I think, Catherine, I'm not sure it was yourself touched on that, but clause 1, clause 2 again about the district council needing not to prepare a rating if it considers that it is not necessary to do so. And you talked about council's other duties in terms of inspections. Could you maybe just explain that a bit?
Yeah, I tried to illustrate that through the fact that they would visit for other reasons. You could have the revisit that I talked about where they've gone back because conditions were really bad. Now, irrespective of any rating scheme and a right for re-rating, if a business is seriously failing to comply with its obligations, the food safety officer will schedule a revisit to check that the business is now complying, because that's the important thing about getting compliance. Similarly, the district council may receive a complaint from a consumer, and they may go out to do an inspection to investigate a complaint. So in those situations, they wouldn't necessarily be gathering the full picture of information which you get at the planned inspection to calculate the rating.
Just, I suppose, to add to that, that's not to say, however, if, for example, there is a complaint and a council goes out to the business outside their planned programme and find that conditions are so poor that they wouldn't conduct a full, proper inspection and gather all the necessary information and provide a re-rating at that stage. And it would be right and proper that they do, because if a business has gone, for example, from a 5 rating to a 1, they should be reflecting that in the rating.
Okay. And again, just in terms of clause 1, it does deal with the definition of food business establishment. And I suppose the question is really the current definition set out in clause 1. What does it really mean in practice? You know, in essence, which businesses are covered and which aren't?
In practice, all businesses which are clearly food businesses and are seen to be food businesses in the eye of consumers that supply directly to them are covered. All restaurants, takeaways, all catering establishments. The kind of business which can be exempt is one where they may have a very, very small food activity, but it's not the primary purpose of the business. So take, for example, this time of year, the likes of Next, which is primarily a clothing shop, may have a couple of fancy goods which happen to be chocolate. Now, the fact that they sell chocolate would make them a food business, and they would require to register that activity with the District Council. But in that situation, because it's a very small part of the overall business and not the primary reason why consumers are visiting that type of business, the current scheme allows for that type of business to be exempt.
Okay, and I think, Paula, you wanted in on this
It's to do with
specific.
But we were told earlier in our research, and you were in there, about there's certain exemptions and things like that. But we're looking at the food hygiene rating in general. I'm on it at the minute on my iPad for my local area, which I know very well. So we have the likes of which are private addresses, which are maybe cakes, wedding cakes, things like that, which are not in in shops doing it. People are doing this from home. They still have ratings.
They do. Yes.
So how do people, other than looking up the internet, that's the only way then they can, because we don't have the stuff in place there to say it needs to be online or whatever they need to do. So how do they check that out? Just by going out onto their council area and looking up?
I think just to be completely clear from the outset, there's two issues here. One is within the bill, the way the definition of food business establishment is defined, in that it relates to those businesses that supply food direct to consumers. So if you are a business and you supply food directly to consumers, you're in scope of the bill. Yeah. So that immediately puts out of scope people who don't supply directly to consumers. So that's the kind of manufacturing end that are supplying to other businesses, not directly to consumers. Now then, within the then those that are in scope, there's a regulation making power to allow some to be exempt. And it's really those very small number of
on here as well. Yeah.
Now they are not exempt because they're on, and they would have to display the rating as well. So they'll have to find a way to display the rating whenever somebody would come to their premises, even if it's their domestic premises, to purchase food. So you have bed and breakfasts, for example. They do operate on a domestic premises, but it's right and proper that that rating is displayed visibly for somebody to see before they choose to decide if they're going to go in there.
Another on that one as well is the likes of where you have someone who provides food in their own home, cooks it and makes it for the local church or the local. I know this because my mother does this. Yeah. She feeds like a drop out centre sort of place, and she provides food. The council have already come out and done all the checks in her own home. Mm-hmm. How does that work? Because that's providing directly to customers. Is that again?
Again, it's very specific to the individual circumstances, and some of those circumstances you're talking about may not need to be registered as a food business, and what the councils will have to look at is the scale of the operation that's going on and how often and frequent it happens. So is it a continuous, frequent and regular activity? Now, if it is, then it needs to be registered, and if they're supplying food direct to the consumer, then they do come in scope of the scheme. Now, there's very, very small numbers of those type of businesses. Really, what we're looking at here, practically, the overarching number of people who are involved is the regular business that you would recognise in the high street.
Well, that would be the likes of, albeit it's because the church doesn't have a kitchen.
Yeah.
So all the food is prepared in my mother's house.
Yes.
Everything's done, and then there's a very small kitchen down in the church that she can use, but she can't prepare it there.
Yes.
Heat it up there. So that would fall into direct.
Again, if
It
she,
could.
if she may or she
I know
may
I'm
not be
just
registered
creating problems
currently.
here, but
No, they're not
My
problems.
mother
They're
will know.
practical. They're practical real life scenarios. And again, it does depend whether your mother's actually registered as a food business. She may have been visited by the council, but she may not be a registered food business as such. They may have given her advice.
okay.
Yeah.
Okay, and you say just finally in clause 1, clause 1.7 talks about the department may by order amend the definition of food business establishment. Why would the department want to give itself a power to, if we're fairly clear that those that are exempt would have a very small food activity, which you've indicated, why would the department want to give itself the power to amend that definition of a food business establishment in the future?
It's really looking at sub-clause 4B, so it's whether you might want to increase the scope to bring in other businesses that don't supply directly to consumers, so the business-to-business trade. And as was pointed out by the research officer before, that is the situation in Wales. And we don't have that in currently because we feel that it is primarily a consumer scheme. The information is very simple and it's purposely simple. It's been devised after a lot of research with consumers, and that's why we've derived the 0 to 5 rating in the way that it looks. So whether it's really relevant to business trade is another question, but it was purely and simply to provide the flexibility, should it be felt in the future that it should be widened.
Okay, fair enough. Joanne?
Thank you, Chair. With reference to clause 2, in relation to clause 2(3)(b), in what circumstances would a council consider it was not appropriate to publish a food business rating? I know, Michael, you touched in your briefing about Ministry of Defence being exempt. Can you maybe outline this in a bit more detail for us?
Can you say again?
Could you just give us the reference?
Clause 2, in relation to clause 2, brackets 3(b), in what circumstances would a council consider it was not appropriate to publish a food businesses rating?
It's 4B.
It's 4B.
Yeah.
It is.
It's really only that circumstance that we've described.
Only MOD for security reasons?
It's the security
no,
reasons.
No others? Right.
You have to provide the get out to allow them not to provide, but we would detail that clearly within guidance that this is the circumstance that this clause what the clause is talking about.
The basic premise on which the voluntary scheme that would be bringing into the statutory operates says everybody's in unless there is a very sound reason, the likes of our own security or something like that, why it wouldn't be the right thing to do. So the default position is that we get everybody in rather than people sort of being taken out.
And it's not that those establishments won't get the rating. They will actually get the rating and they'll get a physical sticker to display on the premises. It's just that the details won't be on the website, again, just for the security purposes.
Okay, then in relation to, says clause 2(6), why does the form of the sticker need to be set down in regulations? You've alluded to that, and it does make you, when I'm visiting my Chinese, you're almost near or somewhere new obsessed with looking to see their ratings, so it works. It has worked very, very well, but I was alarmed. You had said that during your introduction, 65% of those businesses have a high rating displayed, and I think you said only 23% of the low rating displayed, because it's not, it's a voluntary scheme at the minute. Again, could you take us through that, why the sticker?
In terms of the prescribing the sticker, that's very much about what it will actually look like. Although we now have a statutory scheme in Wales, with the exception of the logo of the Welsh Government, to all intents and purposes, it looks exactly the same as what it did before.
So it's not going to alter from currently what we have?
The idea is that the intention is we would prescribe the sticker to be exactly as it looks. And one of the key things is that because the scheme, even though it will get to a place where it might be mandatory in Northern Ireland and Wales, but voluntary in England, the message to the consumer is exactly the same in each country, that they build an identity with this, they know to look for it, they become familiar with it, and fundamentally that it means the same thing.
Okay.
So the detail of this would be laid down in the regulation, but it's the purpose of ensuring that we are clear what the sticker is, and that's the
And it
only one
is
that
fairly
can be
clear,
displayed.
Catherine, you'd said at the start the reason for the 0 being there, because there could have been that misinterpretation that a 1 was good, but with the 0 I think clarifies that well. And finally, in relation to clause 2.4 and clause 2.5, the timescales by which a council must notify the FSA of a business's rating and any timescales for the FSA to publish the ratings on their website. There would be concern that if a business had improved its rating, and you did touch on this in your briefing, from a 2 say to a 4, they would obviously want to publish on the FSA website as soon as possible to avoid losing trade. So timescales around that, have you?
With timescales currently with the voluntary scheme, and that is that the district councils need to upload information at least every 28 days.
Okay.
And that sort of takes account of the appeal period as well, because in the appeal period...
Is it 21 days, did you say, the appeal, or 28?
The appeal period is 21 days, but the period within which councils are, being asked to make sure you put, when they upload the information, they upload a whole brand new set of information for everybody each time, and so the minimum period by which they can do that is 28 days, and it's just to make sure that the information is going up regularly. That's currently detailed in the guidance document. Michael showed you the brand standard, and we would have anticipated putting that, and it means as well that we can reduce that period maybe if we feel they should actually be uploading more frequently.
And just finally, again, for customers that are visually impaired, asked this earlier, is there any other practical way other than orally of letting visually impaired people know about the standard?
In letting them know about what the rating is for a business. No, the way that this has been constructed, it's very much about providing the requirement that if asked, they must be in a position to give that information to anyone who should ask, be they visually impaired or not. And we would envisage that would be a typical way that people would try to find out that information. So say, for example, if you had a visually impaired person who was walking in and wanted to order food, there's certain information they'll need to find out, and to be able to ask what the hygiene rating is something which you would reasonably expect them to be able to do and be provided with.
Thank you. Thanks, Chair.
Okay, thank you. Do you want Kieran?
Yeah, thanks, Chair. Very briefly, on clause 3, it deals with the appeals process. Is there anything in this clause which limits businesses to making one appeal?
It doesn't specifically say that a business can only make one appeal following receiving the rating, but they are tied into making an appeal or appeals within 21 days. So it's tied into that time period. It's, I suppose, quite typical really that appeals are normally laid out in this fashion, and it would be anticipated that if a business wanted to exercise that appeal on the grounds that are there, that they would compile all the information collectively and put it in to the district council. I mean, they could decide then 2 days later to add to that and add some more information, but within the 21 days the district council then needs to look at everything they've received and make the determination.
Okay, thank you. Thanks, Chair.
Thank you, Kieran. And I have Anne next.
Yes, thank you, Chair. Thank you very much for your presentation. Very interesting. In relation to clause 4, in what circumstances would a council refuse to do a re-rating inspection?
Okay, it's very much tied into details within subclause 7. So a district council can only decide to act under that subsection where the establishment isn't complying with the provisions of the Act. So one of the examples that I'd said was where a business may decide they have a poor rating and they just don't wish to display it. They'll take their chances and not display it, but ask for the re-rating, hopefully get a better rating at that point. If they're happy with it, they'll then display. So it's really to deter people from not displaying, and then, in that period, for the period they have to wait for the re-rating. But also, the district councils need to see what the businesses have done to comply, and within the bill, the businesses have to provide information about the improvements they've made. So if a district council just doesn't get any information about that, they just say, they get a request, I want a re-rating request, they really need to see what's being done, so on which to judge the decision and to know what they're going to look at then when they subsequently do the inspection.
If the business wants a re-rating, the burden is on the business to provide the evidence that they've made the improvements necessary. So it's quite reasonable that if they haven't provided that information to the council, then they shouldn't be obliged to proceed with a re-rating.
Okay. And does Clause 4 specify the number of times a business will be able to apply for a re-rating within a certain period of time?
No, there's no limit currently placed on it. And the reason for this is, and this came out quite strongly in the consultation, we asked the question, should a business be allowed to have more than one re-rating request? And the business community said, well, let's say we have a year to wait between our planned inspections. We put in a re-rating request and, we do, some works and our rating improves from a 1 to a 3. That means then we're capped. We have to wait until we get our next planned inspections, but we might be quite prepared to do extra work to push our rating up to a 5. So it was just to give businesses opportunities, because that's really what the scheme is about, improving compliance. So it's allowing the businesses to do that. However, the councils were very concerned that, the businesses might ask for lots and lots and lots, limitless numbers, and this, although the rating's being paid for, it's still very difficult for them to resource that in terms of physical people doing the work. And so they were very concerned and said, well, we mightn't get many, but we don't know because we're not in the statutory scheme. So can you look at it when we're operating it? If it's very burdensome, then come back to this. What we're sort of finding, however, from Wales is that the burden hasn't been as extreme as it might have been thought.
No, they have only had in the region of 200 requests since the scheme became statutory in
a year
Wales.
ago.
So it's really, in terms of the prorata to the number of inspections that are being carried out, the number of scenarios where businesses are looking for the re-rating inspection is very, very low.
Although that may change when it becomes statutory, because obviously the people who are not displaying are not going to be too worried about the re-rating if they're not actually having to display it in the first place.
Yeah, although that is within the statutory
That's
scheme
within
in
the
Wales.
statutory scheme.
Oh,
In the last year since they've had the statutory scheme, they've only had 200 requests for re-rating.
Right.
I think the other important point about where we're starting in from and allowing more than one re-rating, it recognises that not all businesses are the same and not everybody can make the improvements and the investment at the same pace. So for your likes of a major supermarket, it's no big deal to have to put things right quite quickly. And they're likely to be able to do that in one fell swoop, apply for a re-rating and get to a 5. For a smaller business, they may need to invest the money over a period of time to be able to get there. And particularly when it comes to the practices and the procedures, sometimes it takes them longer to really get those running very effectively. So that's why there is the provision for more than one re-rating as a starting point. But as we pointed out, this is an area that we would be reviewing very closely after the 3 years to make sure that it is working both for business and also for the councils and not producing a significant burden.
You've partially really answered my next question, but I'm going to ask it anyway because it's about ensuring the balance of between rights of food businesses who have made improvements and want to re-rating, which you've gone over, and the demands that this will place on council resources. So you've mentioned both those, but where will you find the balance, especially in relation to councils and resources?
It's quite difficult to forecast exactly what the likely demand will be. But in terms of the impact assessments that were carried out as part of our consultation and indeed Wales, the reality, the level of re-rating inspection being demanded is significantly less than was anticipated. There's also likely to be significant activity by the district councils in the period immediately before launching the statutory scheme, where they will work with businesses who currently have poor ratings to try and get them to a better place by the time the scheme goes live. And that's something we'll work closely with the councils and we'll look to support them as best we can to help them do that extra bit of work to get people in a good position from day one.
Okay, thank you. And finally, just on this point, what sort of fee are you thinking of? Have you any idea, any ballpark figures?
The intention
Re-rating.
around the re-rating fee is that it will be a fee set to reflect the work that's actually involved. It will not be about generating revenue, it will be about cost recovery. In Wales, the figure there is £150, which has been set. And so that is something that we'd have to look at in a Northern Ireland context in terms of the actual costs to councils, and we discussed that closely with the councils in trying to come up with an appropriate figure.
Yeah, and obviously that would go to councils.
The provision within the bill is that the councils will be able to keep that money for the purposes of implementing the Act. So it would be helping their funding for services provided.
Thank you.
Thank you, Pam. George?
Thank you, Chair. My question's around Clause 5. And I want to ask, what is the purpose of allowing businesses a right of reply? Is there a danger that this could undermine the authority of the council who is given the rating?
Okay, it is really to, I suppose, let businesses explain to their customers what they may have done to rectify the situation. And generally that's how the right of reply is used. The businesses go on and they may accept that, yes, when the officer was in, there were areas that needed to be improved. But it gives them an opportunity to explain directly to their customers what they've done. I don't think it undermines the council because it goes to the council and they very much have to be sure that it's true before they publish it. So they will look to see that if the business is making a claim about having done things, that the business has actually done those things, and only if they're content that that has been done would they publish that information. So very much the council is involved with the business in agreeing that the right to reply is true and fair.
Thank you.
Thank you, George. Kieran?
Clause 6, can you explain the issues in terms of which sticker is valid? It's a valid sticker. If a business wants to appeal a new rating it has received.
Yes, it is very dense, these sections to read, I have to say. Basically, if I illustrate, I'm a business owner and I have a coffee shop, and today I have a rating of 5. The officer comes in, does an inspection, and in a week's time I get my new rating, which is now today, and it's a 3. I have my right to appeal that. I may not agree that that is a true reflection of what the officer's seen at the time. And so for the period of the appeal period, during that appeal period, really both ratings are valid. So I could choose that I will continue to display my 5 until my appeal is heard, and if it's upheld then I can continue to display my 5. Equally, somebody may get, I suppose somebody may have a lower rating to begin with and they receive a better rating, and they probably will not appeal and they will probably display their rating straight away.
Nature being what it is, they'll keep the higher sticker up as long as they possibly can. Okay, that's right. But you can understand it. Thanks, Chair.
Thank you, Kieran. And Fergal?
Thank you very much. Let's go back to the Kieran time. Obviously, I'll do clause 7 and 9, and 7 says that the department will make regulations as to how and where the sticker must be displayed. And what's the general thinking of that? We know we talked a bit about it earlier on, but is it to be?
The basic principle is based on what consumers have told us, that to have an impact for this to register. I mean, a lot of people, it's the decision to shop somewhere, to buy food somewhere, it's quite instantaneous. They don't spend hours and hours thinking about it. So this has to be somewhere where it really catches you as you approach. So the idea is that the requirement will be for the sticker to be displayed in a prominent place where it is clearly visible from outside the premises. But the reason for having to develop this is we have to bear in mind that we have a variety of types of business. Not all businesses have a front door or a window. We've got food courts and food malls where they're multi-site operators. So we need to work out the detail of where that will work in practice, both for the consumer to be able to get the information and also for it to be enforceable by the local authorities.
Would it be fair to say we've touched on the online aspects of it through some early questions? That would be fair. But can I just touch on the issue that I raised? I know you probably heard, but the business of ringing into a carrier. Obviously, there's an oral potential there, but what about displaying it either on the packaging or on a leaflet that accompanies, or a badge or a sticker that accompanies the delivery?
There's a couple of aspects to that come to my mind. I'll go with those first. Catherine might have some others. One of the things that I mentioned at the outset was that the scheme has been designed with a view to minimising the burdens on everyone, be it both the food business operator and the local authorities. This sticker will be funded by the Food Standards Agency. We will provide these to the council. The food business operator will not have to pay each time they get a rating. If you were to require them to put it on the produce, that would introduce a cost to the business. You also then have the issue where ratings change with time, and if they had stocks of the wrong rating, you can see how it would become quite complex. And ultimately, there'd be the potential for the consumer to be misled. Mistakes could be made, and so on.
Okay. I turn to clause 9. If a council officer has evidence that the correct sticker is not being displayed, they can enforce the display of the sticker. But how would they go about doing that?
In terms
enforcement, how do they
enforce? When are they likely to pick it up?
Well, I
when are they likely to discover?
When they discover, how is it enforced then in that sense? What do they do?
You could have different scenarios. You could, the way the clause is worded, it's not just the food safety officer who can be authorised. So the council could decide to authorise a range of officers that work within the council and regulatory functions who might be checking other regulatory requirements. And when they're carrying out their visits, it may be detected. As I mentioned earlier, the food safety officer will conduct other visits. Other activities include sampling and surveillance, as well as the plant inspections. And at that point in time, again, because this has to be so prominent, that was if the rating wasn't being displayed, they would be able to pick up on it there. Or indeed, they may get consumer complaints.
Yes, that's the detection. What about the enforcement?
Well, the enforcement is laid down in terms of the options for some offences to be dealt with by fixed penalty, and for other offences there is the option of legal proceedings. It would be for the councils to decide what enforcement action they wish to take in the context of their general enforcement policy that they'll have for food safety matters.
Okay, thank you very much. And just 9.3. The issue of the private residence operating as a business, or a business in a private residence, was raised earlier, but the 24-hour notice, that not allow the owner just to get everything cleaned up specifically for that inspection?
You've got to remember that this provision is in relation to the display of the sticker, and the power of entry is to go and find out what the situation is with the display of the sticker. So what is actually happening in the business is not the issue that's being addressed by this power. It is, however, standard practice in terms of domestic dwellings across food safety and other legislation that a 24-hour notice period is the norm. So this isn't something unusual that has been brought into the bill. This is the normal way that domestic premises are dealt with.
Yeah. Does that throw up the issue, though, of entering a private residence for the purpose of inspection? And I'm not aware of that in here.
The same exists in other, yes. So the same exists in all the food safety legislation. So even if you're going to go to a private residence to do an inspection, as you've mentioned, you are expected to give 24-hour notice, and it's because it's to do with the European Convention of Human Rights and Clause 9, which is all about a right to have a right of privacy and home life. And so in exercising any of these enforcement powers, whether that provision is actually detailed in the face of the bill or not, the council officers do need to have regard to that, and they need to comply with that Convention Act as well.
Yeah, but what does that mean for the consumer, who may up to that point have been receiving dodgy goods, but then suddenly the inspector finds the kitchen delightfully clean?
Well, the person can go along and say that it's not there and tell the inspector, but it's only when the inspector goes along to check that they have to give the 24 hours notice. But if you have complaints coming, that people are saying whenever we've gone to buy food at this private residence, they don't display any information to us. We can't see that.
Yes.
That information can be taken as well to create.
We're kind of dancing over the two issues of sticker
Yes.
and inspection.
I think the question you're asking is, does the fact that the General Food Safety Law requires 24-hour notice for domestic premises cause problems in terms of how the person running the business behaves? I think it would be fair to say that in practice, no. You could have a situation where within 24 hours certain bits of cleaning might be attended to if there was an issue. But they can't fundamentally change the structure of the business, they can't change the facilities are there. The records and so on around the practices and how they do things, they can't change that. So there is so much within a hygiene inspection that you can't change just like that you can't really change the picture significantly.
Just on that issue, again, I know from my mother, she has to keep a record of temperatures, she has a book nearly of dates, times, temperatures, when it was used, how it was used, so that is kept
That's part of
for
it.
anybody to come in and see.
Yeah, and the council will be examining that in detail during the inspection. Your next question might be, well, what about if they're making up the records? The way the inspections are carried out, there is a lot of interrogation and checking the validity of that to make sure that you aren't being presented with data which has actually been made up.
Yes.
So, for example, if there are cooking records, can you show me your cooking probe? Can you show me exactly how you take the temperatures? When do you take them? What type of foods? So,
oh, look, there's no batteries in your probe. It doesn't work.
Yeah, if you're trying to cook the books, you can be easily caught out by a good food safety officer.
Okay, thank you very much.
Pam, you had wanted on this
Yes,
issue.
thank you, Chair. It was just in the back of Fergal mentioned online, but I'm not sure that we actually covered the online with yourselves.
Have we not?
So in the bill, you talk about the link to the website. I've already actually seen at the weekend, I was looking at a restaurant website, and they already are displaying the sticker on the web, which I thought was very good. But that's not going to be a requirement in the bill. But I think it's very important that, given the amount of business that is done online and via telephone and other, it should be just as visible as if you were there in person. That should be displayed. I mean, I don't think, when you're hungry and you want to take out, you're going to divert off to the other website to work out the hygiene rating. I don't think that's so realistic. And if some businesses are already displaying it, and I think it's easily updated, it would not be good practice to actually to make it mandatory that it must be displayed on websites.
There's a couple of key issues around that, and the first one is that for some businesses it is quite easy to control and change the content of their website, and they can do it themselves if they're IT literate. For a lot of businesses that would actually introduce a cost because they pay people to maintain websites, and it would also potentially create a burden on district councils to be checking that. And the reality is that resources for everyone in government and local authority are going to become reduced and increasingly under pressure in the near future. And it's important that councils have the ability to focus their resource on doing the work that really matters, which is getting the inspections done and addressing those businesses which are failing to comply and are potentially putting consumers at risk. And to bring in this aspect, you would have to have the enforcement of it as well. You have the added complexity where not all food businesses that you might be ordering from may be based in Northern Ireland in terms of where their internet operation is operated from. You've also got the likes of the supermarkets. If you go to order from a supermarket, you've no way of knowing where the food could be coming from, and indeed that could vary depending on logistical issues with peaks and troughs. So it's actually, on the face of it, putting the rating on the internet, it sounds dead easy, but it's actually rather complex for a lot of businesses.
Okay. Well, what about the other scenario then? That, the restaurant that I looked at, which obviously had a 5-star rating, that's why they had it on. You know, what if they keep the 5-star after this bill passes and goes through? What if they keep their 5-star rating out and say they have another one and they go down to a 4 or 3 or 2, but they don't change it on their website? Is there going to be anything in the bill then to deal with, or say as Paul suggested, somebody decides to print on menus, or as Fergal suggested, on packaging? What if they do get a 5 at some stage, have it printed, use that, and then don't change down?
You're quite right, there isn't anything in the bill, but there is a reason, because the Trades Misdescription Act already provides, it already covers it. So trading standards would be involved in businesses trading with false and misleading information. There's already a legal provision there to allow that to be followed down.
Would that be something they would be checking up on?
Certainly, I mean, there's instances even within the voluntary scheme where we've come up against some instances of people. I think there was a lovely example of somebody in Fermanagh who had a big sign made, and like a big light that flashed. So, but their rating changed, and the council had to, and you know, at least in this instance, the council went and spoke to the business, and they weren't very happy about taking it down. But they did say, well, you're contravening the legislation. We're going to report you to Trading Standards. Trading Standards know about it. They're quite prepared to take action because this is misdescribing your actual operation. And then the lovely light came down.
Okay, thank you.
Thank you, Pam, for that. Rosie's next.
Okay, I'll be brief here. It's in relation to clause 10, and the where someone could be committing offence for failing. What is it? Failing to display a sign. So you were saying there that it would be for the courts to decide what was a reasonable excuse. Is it only for the courts, or can someone make that decision in other circumstances?
The provision around reasonable excuses is something which the food business operator would try to demonstrate if they were charged with an offence, so that would be for the courts to decide. However, in any situation where a district council finds that a business is not complying with any aspect, they will always gather the full facts and evidence around the situation. They won't make assumptions and they won't jump straight in. So they will gather the full picture, and from there they will decide the appropriate action. But it would be for a court to decide if there was a reasonable excuse.
But I think what you're saying is right, because the District Council may decide not to serve a fixed penalty notice in a circumstance because they feel the reasonable excuse is fair. But
that's what I was getting
yes,
at, yeah.
yes, the councils would do that.
So there's scope, yeah.
Yes, absolutely.
Make a sense rather than go through a process.
Yes, it doesn't have to go to the court to make a decision when it's quite obvious.
So the council would be could make that decision.
Yes.
Yes.
The council has the flexibility to decide whether or not it feels a fixed penalty notice is the appropriate way to go.
Okay. And in circumstances where someone might be displaying a sign and it was telling lies, let's say, and it wasn't an honest indication, how will the council monitor that? Will they be sending people in to check, or to act as, you know, clients and things like that?
The councils will have, you know, as Michael sort of said, the bill doesn't just mean that an environmental health officer is the authorised officer. It can be any officer of the council they can decide to authorise. So, for example, you might have people out who are there for other council business, and they could be tasked, you know, when they're going into, when you're down the street and you're going to do your business, if you see any food businesses that not display, make a note and let us know at the end of the day so we can follow that up. They'll be in for all sorts of out and about on their districts for all sorts of reasons, for street cleaning, for doing food hygiene inspections, following up complaints, for health and safety visits, for consumer protection work around goods and services that aren't what they say they're going to be. So the council, particularly even in the environmental health department that Michael and I have both worked in and we're very familiar with, they will be in the commercial businesses quite regularly. Right. For a range of different reasons.
Can a member of the public make a complaint?
We are in a good position in Northern Ireland in that our research shows us there is a high level of awareness of the food hygiene rating scheme already. when we have the statutory scheme, we would expect within a fairly short space of time that people will come to expect it to be there. They will know that it's something which the business should be doing. And in Northern Ireland, when people find things wrong, they are quite willing, of that nature, they're quite willing to tell people about it. So we would expect consumers, if they approach a business and there's absolutely no sign of the rating, that they would lift the phone and ring the council and tell them. The council would then investigate that in accordance with their complaints procedure. They would go out and follow it up very quickly.
I mean, we quite regularly, even now, we get consumers phoning us and saying that the business isn't displaying on websites because it's not currently mandatory. So, you know, there's good knowledge.
Okay.
Yeah.
Get on, thank you.
Okay, thank you. Just to carry on that issue as well, to do with the fixed penalty notices. I know it says in clause 11, you go then to clause 10, where an operator isn't displaying, or where they're displaying the wrong notice, then it's the council then that issue the fixed penalty notice.
That's correct.
That's correct.
Yes.
Do we know what how much that's going to be? What the fixed penalty is?
The level of the fixed penalty will be set by regulation, having discussed with the councils what the actual cost would be. We envisage that it would likely work out something similar to what they have in Wales, which is, sorry, I'm completely wrong. In terms of the fixed penalty, it's been set in Wales at £200, and if you pay within 14 days, you get a 25% reduction to £150.
But really, there's no reason why the actual fixed penalty notice cost couldn't appear in the face of the bill. I suppose we looked at other schedules across other similar bits of legislation and to have a sort of consistent approach across Northern Ireland, but there's no reason why the fixed penalty notice fee can't be on the face of the bill.
I'm sorry, how many days did you say they had to pay it within? I'm just writing it down here.
They have to pay it within 28 days, but if they pay it within 14, they get a reduced amount by 25%. So it's just an incentive to pay it quickly.
And then is there an onus put on council to notify the public in any way that someone's received a fixed penalty notice?
No, not currently.
No, it's not. Because we've had other bills, we look even at the tobacco retailers bill where people were breaking the law. You know, it was then decided we need to let the public know that these people are breaking the law.
Yes.
By various means. So there's nothing in the bill at the minute.
Nothing currently in the bill around that.
Okay. Well, that's grand. Kieran?
Thanks, Deputy Chair. Clause 14, 2 or 3 quick questions. This states that the review will be 3 years. How did you determine the time period of 3 years?
Okay. Also within the bill, there's provision for a transitional period, because obviously when you're moving from one scheme to another, there needs to be a period to allow for the schemes to transfer over. Looking across at Wales, their transition period is 18 months. And I mean, there's good reasons for that. It's tied in with the sort of frequent period that officers do planned inspections of 18 months. So businesses were businesses were quite concerned, and the district councils for some aspects of the scheme, that those bits should be reviewed when the scheme was live as a statutory scheme to see if the burdens were greater than had been anticipated. So we mentioned about the limit on revisits and the independence of appeals. So the period of 3 years came about because it was considered that once the scheme had formally, transitioned over, that could take 18 months. And then you'd need to allow at least a year of everybody being in the scheme to give them a fair opportunity of noticing any issues that were affecting them. So it's just to capture any issues within that time period.
And are you confident that you will have the resources to carry out the review every 3 years? And if, for example, priorities change or budgets is cut, where do you stand there?
The requirement in the bill is to carry out a review within 3 years. It's not every 3 years, because the idea is that any significant issues will have emerged within that period, you know, within 18 months of the transition being completed. In terms of having the ability to conduct that, the Food Standards Agency takes the food hygiene rating scheme extremely seriously. I mean, it is has been one of our flagship policies over the last few years. And clearly, if this provision is enacted, we would take that as a serious responsibility and would ensure that we do carry that work out, because it will be important to the long-term sustainability of the scheme to make sure it's working for both businesses and for the district councils.
Okay. Clause 14.8 then gives the Department the power to amend the legislation by statutory rules to implement any recommendation made in the review. Does this leave open substantial aspects of this legislation to be changed at a later date through statutory rules? In theory, would this allow the Department to attempt to amend the legislation at a later date to say there should be no appeals allowed and no re-rating allowed? Shall I stop or shall I go on?
The intent here is very much about refining the safeguards that we have currently got. Having appeals processes, having the right to re-rating are fundamental to the fair and equitable operation of the scheme. And there certainly would be no intention on our part to remove those. The background to the whole scheme is that in coming up with the voluntary scheme that this is now based on, we sat down with industry around the UK and with all interested parties, and there was an awful lot of time and effort went into building the voluntary scheme the way it is. And these safeguards really are fundamental, and we would only be looking to refine those, and it would not be in any shape or form possible to remove those because they go to the heart of the sustainability and credibility of the scheme.
Or to amend the legislation to say that a council has 6 months to respond to an appeal. If the FSA does not have a firm understanding as to how the legislation will operate in practice, and hence thinks that they need to be able to have a mechanism to substantially change it at a later date, is this really the right time to be bringing forward this bill in the first place?
In terms of extending an appeal period, the norm is that appeal periods against a decision are always short, and they have to be set at an interval that is practicable and reasonable. And to move that way out would not work. It wouldn't make the appeal rational and fit for purpose. So there wouldn't be an intention to do that. In terms of your question around, is this the right time to do it? We are very mindful of the current climate and indeed the change which district councils are faced with in terms of local government reform. But in terms of when we would get through this process and bring the Act into place and to have the regulations enacted, we would be taking that very much into consideration. And at the heart of this is the fact that the proposals within the bill are very much about moving us from the voluntary to the statutory, but minimising the burden. The councils, every council in Northern Ireland is currently operating the food hygiene rating scheme on a voluntary basis. And it's important that we try and maintain the scheme as common as possible. And therefore, provided there aren't significant burdens introduced over and above what is currently required, then it should be relatively straightforward for councils to be able to take this scheme forward, because the burden on them is pretty much the same with the exception of enforcement. But again, we would expect that the vast majority of businesses will comply. We've also got to remember we have a very small number of businesses with poor ratings in Northern Ireland, and those will be the people that will be the focus of attention.
Thank you very much.
If I can just cite very, very briefly just on that, the issue of amending anything as a result of the review is really very limited to only those aspects in subclause 3. So it's only very particular things that were raised as issues that needed to be reviewed in the consultation, but also just to point out that they can only be made by order that are dealt with by draft affirmative. So they have to get voted in the Assembly. They have the highest level of scrutiny. If Assembly members do not agree with anything that comes forward in those regulations, they won't be voted through.
Okay,
thank you. Kieran Fergal, you want to
Yeah,
come
I just
in
want to
here?
revisit something around it. What was the rationale for choosing a level 3 fine? Say that back to earlier.
Clause 10.
Clause 10, yeah.
The reason, the primary reason for choosing a fine at this level is that it is consistent with other legislation in terms of the nature of this particular offence. So that was the rationale for it. And if you look at failing to display a notice compared to, say, for example, the substantive offences for not complying with food hygiene legislation, which sit at a higher level, it's giving you that differentiation between the things which really, if they're not done in accordance with the law, can negatively impact on consumer protection versus providing information. So that's the rationale in terms of where we have placed this in the bill.
Would it be a sufficient deterrent?
Ultimately, in terms of it being a deterrent, whether it's sufficient or not would depend on the action taken by the courts, and whether or not you have the maximum sitting at 1,000 or 5,000. That may or may not have a significant impact on how a court decides to set a penalty. So it's quite difficult because that is within the gift of the court to decide what is appropriate.
And what's the extent of any research that's been done around the impact that it would have on those businesses, smaller businesses, who would have, in terms of loss of trade, that this would have on them? Have you done any research into that?
We haven't done research into that, and one of the key things here is that you've got to remember that in terms of the ability to get the top rating of 5, that is a business doing no more than the law currently requires them to do. In this scheme, it was the requirements to be able to get a 5 were very, very clearly set out so that there is no gold plating and you don't require good practice, you don't require bells and whistles. If you've got them, fantastic, you will have no difficulty getting your 5 and hold on to it. But this is only about getting businesses to a place where they're doing what the law regarding food safety currently requires them to do.
But let's imagine a bigger business that could afford to potentially absorb the fine and carry on. So, without that research, is there not a danger that you may not hit on the right level of fine?
Again, I think you have to look at it from the angle of how the regulatory framework currently operates. And if you look at the penalties which exist for significant food safety offences, the level is set for different types of offence, but it doesn't take into account the size or nature of the business. And when it comes to the setting of the level of fine, it in effect does work on a one-size-fits-all. It doesn't differentiate between different sizes of business. That's the norm in terms of how levels of fines are set. You're right to say that for some businesses it might be easier to take the hit. But another way of looking at it is the bigger businesses who have got more of a reputation to protect are probably less likely to want to take that chance. It wouldn't make sense for them to be failing to do something of this nature because it just wouldn't be worth the negative publicity.
Again, the word that leaps out at me of this is deterrent value, and ultimately a court might, while it has a ceiling of 1,000, may come in at 500, so you can't be assured. So would the proviso, or at least the provision of a higher fine in terms of deterrent value, not be something to have in your armoury?
I think it's fair to say that Michael's right. We've sort of looked across broadly at other types of offences and penalties, and that's where we've come to the level 3. But we're certainly prepared to take the committee's views on that. And if you think that that's not appropriate, that's something we can look at.
It's down to the deterrent thing. Ultimately, we don't want anybody getting into court. We want good food served well and it's cooked and prepared and safe and clean surroundings. So that's the ideal word. And it's not about ultimately, some businesses it may not count £1,000, whereas merely having the provision might. And of course, it's up to a court in any event to impose those fines.
One other thing that the committee may wish to bear in mind is that in England and Wales, the levels of fines is currently under review. Now, there's a set of regulations that have been made pursuant to an act that will apply to England and Wales, which, if those regulations go through, which we envisage is quite a strong possibility in the relatively near future, the level of penalty associated at level 3, the maximum, would move from £1,000 to £4,000. So automatically, through the review of the level of fine in England and Wales, you could relatively soon have a situation in Wales where the maximum fine would actually be £4,000 because the top of level 3 has moved.
Oh, right, it moves.
It's going to move up.
Right, and then yeah, okay.
So that's something, again, which members may wish to
Right,
consider in this particular.
Can you just touch on one final thing, conscious of time, of course, but it's important to go through them all, and thank you for your time. In terms of defacing a sticker, who's that clause, who's that aimed at?
Anybody who defaces it?
How do you know?
Well, I mean, there would need to be clear evidence that, you know, of that to go to court and present that and be able to prove beyond all reasonable doubt that that was the case.
So it covers anybody.
Yeah.
And can a shop owner or a food outlet owner claim that somebody else defaced it? Is there a clause in there which says you're not allowed to display a defaced sticker?
You're not allowed, well, you can't display a non-valid sticker.
Yep.
And there is an offence in the bill for that. So if you're displaying a sticker that's not the valid sticker, then that is an offence.
Well, does that give them a defence if they didn't display a sticker?
No, it's still an offence not to display the rating sticker if you've been provided with the rating.
It's also a defence not to display. No, it's let's just get this clear.
Either way.
In other words, if something defaced, they take it off.
Yes.
Because they're not allowed to display a defaced sticker. Surely that gives them a defence for not displaying the sticker.
Well, I think what the council officers will do will listen to what they're being told and look at that and collect information and consider it on the face of it. And if they don't believe it,
But is there any provision to be made there? I mean, is there a gap in the provision?
No, I don't think so, because if somebody defaces a sticker, they can rightly phone their council and ask for a replacement. So,
That
you know,
can be readily available?
absolutely. That,
Oh, right, so okay.
yes, yeah.
At no extra cost.
At no extra cost.
If something happens and someone either defaces, tampers, removes or whatever, and you need a new sticker, there will be absolutely no difficulty in the local authority providing one very quickly to enable you to comply once you've realised that something has happened to your
I suppose
valid
if
sticker.
you have notified the local authority as soon as you realise, then it's on their records that they've been notified anyway.
Yes.
Is that okay?
Yeah, that's good. Okay. Thank you. Thank you.
Thank you. You're very glad to hear we're nearly finished, and so will the members. We're very glad to hear we're nearly finished with this. It's just a few final questions on the schedule at the end of the bill, and again, it's come back to the fixed penalty notices. And in paragraph 10, it states that the money accrued from fixed penalty notice must be spent for the purpose of the legislation. And then in paragraph 14, it goes on to say that it gives the department the power to change how much money from fixed penalties can be used.
Yeah.
So, why do we have one then that seems to contradict the other?
Well, it's not to contradict it, but in the first instance, so if fixed penalty notices are served and those monies come in, the council will retain those, but they must use them for purposes around the bill. And then the regulation power in 14 says that the department could make regulations to say that that money could then actually be used for something else. I mean, we certainly don't anticipate that we would use it, to be honest. We don't even anticipate that there's going to be huge monies generated from this. We've looked across to the likes of the display of the non-smoking sticker at the time of the smoking ban, and very tiny fixed penalty notices were served. Now, obviously, that is a different circumstance, and we would expect there would be more in this because it has more of a business impact, really. But we don't expect there to be huge sums of money generated.
Say, in Wales, since they introduced their scheme, they've only had 9 fixed penalty notices issued.
And I would say if it was to change, we would have our local councillors onto us anyway, demanding why, because most of us have all come from local council, and we'd be wanting to know why the money was being taken away from local council. So you would have, there would be issues with that anyway.
We certainly wouldn't want to take it away from the councils and the regulations. It might just be to use it for a purpose that wasn't just for the Act. Like, maybe use it for other food safety reasons.
Okay. Yeah, okay. Which you could understand might actually be acceptable in some cases, because it's all working within one department within the council, which is fair enough. And just finally, and it's in relation to paragraph 14 of the schedule, what circumstances, if you can just briefly tell us what circumstances would fix penalty notices not be given under paragraph 14 of the schedule?
I think it's if the circumstances are seen to be serious and that you might just want to go straight to court.
Instead.
Yeah. So if somebody, for example, is willfully telling lies and putting up a misleading non-valid sticker, that's different from somebody just whose sticker's fallen off and haven't realised for a week. You know, it's a more serious offence. You're going out of your way to actually misrepresent your business to consumers.
Okay, I think that's us. Catherine, Michael, thank you very much for your time. And you're free to go now at last. You'll maybe just catch the lighting of the Christmas tree and the carols as you go out the door. Yeah. Members, we have to adjourn until Rosie comes back. She is coming back because her glasses and stuff's there. So we can't lose anybody else because we need to do statutory rules and things need to be done. Okay, members, next I just need to remind you that the timetable and work schedule for the food hygiene rating bill, which was considered by the committee at the meeting on the 5th of November, was drafted to reflect an extension of the committee stage of the bill from the 13th of January 2015 to the 8th of May 2015. Can I seek agreement for the committee that the motion be lodged in the business office?
Agreed.
Okay, I need to read this out then, yeah. Okay, for the record then, I'll read it out. So it will be that in accordance with Standing Order 33, Section 4, the period referred to in Standing Order 32, Section 2 be extended to 8th of May 2015 in relation to the committee stage of the Food Hygiene Rating Bill NIA 41/11-16. All in agreement?
Agreed.
Thank you. Okay, can I also advise members that Belfast City Council has secured the agreement of Eurist for committee members to accompany its food safety officers on a visit to the catering facilities in Parliament buildings on Wednesday the 3rd of December 2014 at 4 p.m. The aim of the visit is to give members an insight into food hygiene inspections and how these relate to food hygiene ratings. Can I seek agreement from the committee for the visit to the catering facilities here on Wednesday the 3rd?
Did they know that they were coming?
Agreed.
I'll give them notice.
I think we've given them
normal?
sufficient
Is that
notice.
Okay.
Yeah. Okay, members, we're going to move on then to statutory rules. Can I refer members to page 185 of the meeting folder and page 29 of the tabled folder for the relevant papers, including a copy of the Examiner of Statutory Rules report, and that's Statutory Rule 2014, number 267, the Health and Social Care Disciplinary Procedures Regulations Northern Ireland 2014. The committee considered and approved the SL1 for this rule at its meeting on the 15th of October 2014. There have been no changes to policy content since the SL1 was submitted to the committee. However, I have to advise members that the Examiner of Statutory Rules has drawn the committee's attention to the regulations on the grounds that they contain a number of drafting defects. These defects have been acknowledged by the Department of Health. The Examiner has also raised the point that the appeals procedure in Regulation 6 is in need of restructuring after some 66 years in much the same form. The fundamental problem being that a panel hears the appeal, but the Department actually decides it on the basis of a report from the panel. The Department is receptive to this view and intends to consult the Regional Health Board and the relevant professions. And can I advise members that the examiner's overall view is that it would be better to replace these regulations, which came into operation on the 24th of November 1914, or now 2014, that would be some time ago, yeah, as soon as possible, albeit the Department needs to consult on the appeals provisions. In the short term, the Department intends to tidy up the errors in these regulations that should, in the examiner's view, be followed fairly quickly, allowing for the necessary consultations by a full set of replacement regulations incorporating the appeals provisions. So can I seek agreement to write to the Department to get a firm undertaking to that effect?
Agreed.
Thank you very much. Okay, I also need to advise the members that if the committee was to pray against the rule and the motion was passed by the Assembly, there would be no regulations at all in place to deal with these matters. It would seem that the best course of action would be to agree that the committee is content with the statutory rule, subject to the Department taking the necessary action to address the issues highlighted by the examiner. Are members content with the statutory rule, with the caveat that the Department should address the issues highlighted by the examiner?
Agreed.
Okay, I'll put the motion, and that is that the Committee for Health, Social Services and Public Safety has considered SR 2014 number 267, the Health and Social Care Disciplinary Procedures Regulations Northern Ireland 2014, and has no objection to the rule, subject to the Department of Health, Social Services and Public Safety taking the necessary action to address the issues highlighted by the Assembly Examiner of Statutory Rules.
Agreed.
Thank you very much. Okay, members, Forward Work Programme, page 203, is in our meeting folder. Any issues on that?
Agreed.
Great, good stuff. Okay, then we move on to matters arising, and there's one item under matters arising in the meeting folder and one item in the tabled meeting folder. Are members content to note?
Agreed.
Okay. Members, on another matter that arose last week, we agreed to write to the Department regarding the scheduling of a brief from officials on the PRS and Cancer Drugs Fund issue. The Department had advised the Clerk that it was not in a position to brief the Committee until January 2015. The Committee requested an explanation for this, and its proposed date for briefing the Committee on these matters. We requested a response from today's meeting. Unfortunately, no response has been received, which is disappointing, and I would hope that we'd have the response by next week to consider.
We should wait for next week.
Okay, thank you, members. Okay, then we move on to correspondence. There are 6 items of correspondence in the meeting folder. Are members content to note the correspondence?
Agreed.
Okay. Next item is any other business. Do members have any other business? Go ahead.
Yes, Chair. Some of us, I know you weren't able to make it this morning, got caught in traffic like myself, but I know Rosie and Fergal, Gordon and myself were all present for Bride Turley's breakfast, and it was on Huntington's disease, and it was very, very, very interesting and quite shocking to see how little provision these sufferers are receiving and their families are receiving. So I'm not sure what exactly we'll be asking for, but I think we should be asking the Department at the very outset anyway for detail of what provision of care and support services there are for these Huntington's disease sufferers at this stage. And I know the members will probably have different questions that they'll want to put to the Department as well, but I think at this stage
Maybe just seek some broad information around it. It seems the baseline provision isn't even there, and at least getting some answers around those issues in the first place, and maybe delving into the issue further, which also forms part of the wider narrative around rare diseases and provision there.
Absolutely. No problems with that, yeah. That's fine. Thank you, members. Okay, finally, members, date and time and place of next meeting. The next committee meeting will be on Wednesday, the 3rd of December 2014, starting at 2 p.m. in the Senate chamber. Thank you very much.
Finishing before 7 p.m.
Yo, tomorrow.
Speed rate.